On behalf of the National Autism Trainer Programme, good afternoon and welcome to the information session for the Residential Special Schools and Colleges New Strand. We will take a minute or two until more people have a chance to settle in, and then we will start our session. Welcome again for those who have just joined. Welcome to the National Autism Trainer Programme. Today's information session on residential special schools and colleges will start in about 1 minute. We're just waiting for a few more people to be able to join us. Thanks, everyone. So, good afternoon and welcome to the National Autism Trainer Programme. Today's information session is organized by Anna Freud in partnership with our good colleagues at AT-Autism. The Residential Special Schools and Colleges information session is commissioned by National Health System and Department of Education. And the next slide, I'm going to go through with you. Hannah, you're on the next slide. I'm going to go through the program for today. So we will start with a very brief introduction about the program, and then we're going to hear different testimonies from people about why this training is needed. Then you're going to hear from us about how at the National Autism Trainer Programme we're framing the work that we're doing with autistic people, with people from the autistic community who are co-producing and co-delivering this course. And then you're going to hear from professionals. How do they see the need for a different approach? Why this training matters to them? Finally, we're going to explain practicalities about how you can join the National Autism Trainer Programme, how you can register, how you can be involved, and the ongoing support that we can offer to you as part of this program. Last but not least, we're going to answer to your questions. We're going to have a Q&A session where we can discuss all of the above and any questions you might have. Next slide, please. My name is Dr. Pavlopoulou. I am one of the co-directors of the National Autism Trainer Programme. I'm based at Anna Freud Centre, and I'm also Associate Professor at University College London. I am a co-strategic lead and co-director with Dr. Ruth Moyse from AT-Autism, who is also a research associate at the University of Southampton. I will take you through the first part of today's session, and I will introduce its sections, and later on you will hear from Dr. Ruth Moyse herself, where she's going to lead the discussion part. Next slide, please. So we have a hashtag, NAT for Mental Health, if you want to tweet or if you want to follow on social media and find out more about our updates. Our mission here at Anna Freud is to close the gap in well-being and mental health by advancing, translating, delivering, and sharing the best science and practice with everyone who impacts the lives of children and families. The National Autism Trainer Programme is commissioned by NHS England in partnership with Anna Freud and AT-Autism, and we aim together to support NHS staff as well as educational staff in providing care to diagnosed and undiagnosed autistic people. Next slide, please. So, National Autism Trainer Programme is a Train the Trainer program. It does focus on all things autism and mental health. It sits in the Education and Training Division of Anna Freud. The curriculum is fully co-produced with and co-delivered by over 60 autistic people. It is underpinned by valuing both the well-being of autistic people as well as the staff members who are working with them. The National Autism Trainer Programme promotes an experience-sensitive, trauma-informed approach and is being delivered nationally across all ages in inpatient mental health hospitals, in community mental health services, in secure welfare and youth justice settings, and residential and special schools and colleges. Today, you're going to hear all about how we have set up and why we set up the residential special schools and colleges. At Anna Freud, we value the We value the meaning of partnerships, and we can only deliver this program due to important partnerships. One of them is with AT-Autism, our key partnership, which has been successfully started during the delivery of the pilot of this national program. The pilot received back in 2021 excellent feedback on the way we approach the topic of autistic mental health, on the quality and the impact it can have on the trainers, from the delegates who attended, as well as commissioners and the autistic community. We continue working with AT-Autism together in an equitable partnership across all stages of the National Autism Trainer Programme. We're working as well with the wider autistic community. We're recruiting people of all ages, all nationalities, all genders who are autistic to join the pool of our autistic autism trainers and our autistic content developers. We work with autistic people in order to offer a very authentic, co-produced and co-delivered program. Autistic people are contributing, as I've said earlier, across all aspects of our curriculum. Next slide, please. So a little bit of housekeeping before we start with the talks. The webinar will be recorded, and this will be made available after the event along with the slides to all of you. As you might have already noticed, we have British Sign Language interpreters throughout the event with closed captions as well that you are able to use if you want. Please note that throughout the event, because it's a webinar, your video, microphone, and raised hand function and chat are switched off throughout the duration of this event. However, you can post comments and questions in the Q&A feature, which can be found at the bottom of your screen. And we will do our best to answer most of these questions during the Q&A panel discussion. We will also circulate a document where we're answering all the questions when we will send you the recording and the slides. I forgot to mention earlier that we will also have a break that's going to be approximately at 2 o'clock for about 10 minutes. So the first section for today's event is a collection of testimonies about why this training is so much needed in residential special schools and colleges. First, we're going to hear from Professor Peter Fonagy. Peter Fonagy is the head of the Division of Psychology and Language Sciences at UCL, University College London. He's also the chief executive at the Anna Freud Center. He's consultant to a number of organizations. He holds visiting professorships with Yale and Harvard medical schools. He has been executive clinical director and consultant and chair across a range of NHS and non-NHS positions. He has chaired NICE guidelines and other groups around children's mental health. With no further delay, let's hear from Professor Peter Fonagy about why this training is needed.
Welcome and good afternoon. I'm Peter Fonagy, Chief Executive of Anna Freud. The National Autism Trainer Programme was established to spread a new understanding of autism and autistic people, which is neurodiversity affirmative, experience sensitive, and trauma informed. The overarching aim is to improve care and quality of life for autistic people, initially within mental health setting, and now also for autistic children and young people in residential schools and colleges. The aim of the National Autistic Trainer Programme are in line with the Anna Freud Closing the Gap strategy. This new course being launched today seeks to close the gap in staff attitudes and skills through training that is authentically co-produced and co-delivered with and by autistic people. Autistic people with a range of lived experiences. Autistic people who may be clinicians, parents, academics, or young people, for example. One of the key issues the course addresses is the use of restraint and restrictive interventions. We know that these practices can have long-term consequences on the physical health and mental well-being of autistic children and young people. and that such practices can have negative impact on the well-being of staff who carry out such interventions. Autistic children and young people, their families and carers, question the use of restraint and seclusion. There is evidence that autistic students with or without a learning disability are overrepresented in those young people who repeatedly suffer imposed withdrawals or physical, chemical or mechanical restraint. They have said that restraint and restrictive interventions are traumatizing. These children and young people would like support to stay safe and to keep others safe. Their parents and often members of staff worry that restraining practices become the first or standard practice for particular students. They are concerned about the long-term or institutionalized uses of restrictive interventions. Some residential staff may struggle to understand autistic expressions of depression, anxiety, joy, and trauma, which can result in restrictive practices. Some staff may feel pressured to apply policies and practices that autistic children and young people tell us do harm. They may not understand how autistic minds work and how autistic young people experience the world. Or they may simply be too burnt out by the demands of their job to remember to just pause. Whilst there are examples of good practice in residential schools, there are also evidence that some staff use restraint to punish autistic behaviours and distress responses. Reduction or elimination of these practices is achievable. Achievable when we are better informed about autism, when we understand that autistic learners can be mentally healthy and that our attitude and approaches are fundamental to this. When we examine staff narratives around autistic young people and behaviours of concern, when we support staff with their well-being, when we remember that we are all human and deserving of compassion, when we build acceptance, a sense of belonging, and a sense of connection. This latest course from the National Autism Trainer Programme offers frameworks, key approaches, and the opportunities to reflect and discuss with like-minded colleagues, all working to improve the lives of autistic children and young people in residential, educational contexts and beyond. So, welcome to this program, and thank you for attending.
It was very nice to have virtually with us Peter Fonagy, and indeed describing our effort or how we aim to close the gap in staff's knowledge, as well as to highlight good practice that we do recognize is also happening in residential, special schools and colleges. Next, we are excited to have live today with us Team Devanney, the lead for learning disability and autism programs in NHS England. Thank you so much for being with us today, team. Over to you.
Hi, thank you. So yes, I'm the lead for our programs in the Workforce Training and Education Directorate, and it's my absolute pleasure to spend just a few moments giving you a little bit of the background of how we got here today and how this training arose. It became stark and clear to us back in 2019, following a series of Care Quality Commission reports regarding the treatment of children and young people in mental health units, that staff just weren't getting any, or if they were, very little autism training. We recognised there was a real need there. That lack of training was resulting in very poor and in many cases harmful care. So in order to respond to that, we needed to find something that would allow us to reach into every inpatient unit, that would be acceptable, and that would be able to reach every member of staff in all those units. So we co-produced this piece of work. We brought our autistic children and young people together with local trainers from each of our providers, and listened very carefully to what we needed to provide and put in there. What we heard was and this is fundamental to all our work, is that it needed to be co-produced and co-designed. That we needed one common set of materials that everybody understood, that was quality assured, and that was speaking the same language. We needed to have a network of support for our trainers, and that be our trainers and our co-trainers, our autistic co-trainers. And we understood that we needed flexibility in delivery, flexibility so that staff, trainers who were trained could adapt their presentation styles, they could adapt their training delivery to the local needs of their staff and their team, so they could reach not just the staff that work there every day, but the agency staff and the bank staff that are often a common feature in those inpatient units. So we pulled together something that would fit together and work for everyone there. Could we go on to the next slide, please? So initially, our reach was into child and adolescent mental health services. We commissioned an evaluation of that work, and it came out as very successful. And what was clear is we couldn't stop there. The model and the training that we found was valuable, but it had potential to reach into many other services. So in that point, we expanded it out into all mental health services. So we're reaching into adult mental health services, inpatient services, and latterly we've extended that to all mental health services. So that includes all community provision as well, and now residential special schools and health and justice settings, which is it's wonderful to see it progress so far. Could we go on to the next slide, please? So what we have now in the National Autism Trainer Programme is training that offers that consistent understanding, and now a consistent understanding that should reach across the multitude of services that people may need to use across health, across care, across education settings. Training that's co-produced and co-delivered, and that underpins strength. Training that recognises the needs of trainers, and that they need time to be supported, they need resources to be supported, and they need to be able to think together and develop the training as it evolves according to service need. At the end, we need to get to the point where we've changed culture, and that autism training is just everyday business. It's what we do as part of our business as usual. Okay, I feel that this is a good place for me to stop and hand over to Kate.
Thank you so much, Tim. And exactly as you said, it's all about changing culture, it's about supporting staff to shift mindsets into neurodiversity affirming ways, understand the science and how the context of autism has been evolving. Thank you so much. We're excited to have today with us Kate Dixon. Our program is also supported by Department of Education, and Kate is Director of Pupil and Wellbeing and Safety Unit in the Department of Education. Over to you, Kate.
Thank you for having me, and thank you to Peter and to Tim as well. So my role is within schools group in the Department of Education, and I've got particular responsibility for wellbeing and safety, including safeguarding. So the Department of Education is really pleased to support this programme with residential special schools and colleges, because there are hundreds of residential special schools and residential special colleges that are supporting and educating thousands of pupils and students. We recognise the importance of the findings from the Hesley reports, and we're continuing to support the development of a skilled workforce in residential settings and giving those who need it tailored training. The close linkages between education and health are really important, and it's really important to strengthen them further by delivering consistent messaging and training about autism. Comes up a lot in the work that I do around wellbeing, mental health, but also in the responsibility I have for residential special schools and the standards that support those to be brilliant. This training provides sustainable train-the-trainer models, which keep the outcomes for autistic young people at the centre, and it will provide the workforce with new skills and a greater understanding of the needs of young autistic people, both those diagnosed and those undiagnosed, as we're better understanding traits as well as diagnosis, as well as any additional wellbeing and mental health needs that they might have. And it is funded, which is fabulous. In terms of various bits of statutory and standards that I'm responsible for, this training will support residential special schools and residential special colleges to meet their statutory requirements and standards. For schools, we have Keeping Children Safe in Education, safeguarding guidance. We also have national minimum standards for residential special schools. For dual registered schools, the Children's Home Regulation Quality Standards. And for colleges, further educational residential accommodation, the national minimum standards there. So this is a fantastic offer. I'm delighted to be part of it, and the department encourages everybody who is eligible to sign up and learn and benefit. Thank you very much for having me.
Thank you so much, Kate. That was lovely. So we have heard from key members of our team as well as from the funders, and now we're going to hear from some families. First, we're going to hear from Dawn. For the next bit part of our information session, you're going to hear stories that represent the good and the difficult stuff that autistic people and their family members have been telling us as we were curating the curriculum. One of them is Dawn, Dr. Dawn Kavanagh. Dawn is presently working on a new National Institute of Health research study entitled My Medications and My Mental Health. She's a researcher that is very much dedicated into the field of autism, learning disabilities, mental and physical health. She's also the mother of a young person who is autistic with learning disability. And both her and her son are autistic and have experienced a residential special school and college environment. So we're going to hear from Dawn what was it like, and some of the reasons of why she thinks this training is essential and can make a difference.
He was 16 and he'd had his 16th birthday and things were okay, and we took him to the zoo for his birthday, and he had a lovely day out. We had a feed the tappies experience, and I remember that was really nice. And sometime in between the February when he turned 16 and the September, his behaviour deteriorated. When we went to look at it, didn't like it. There was no choice at all. And I think he hadn't been there. He'd only been there a day or two, and he was already put in restraint. And what was interesting was that they put it into the documents before he went about contraindications for restraint before he even arrived there, when he'd never ever been restrained before. Well, it was called a college, but he didn't really engage in the college. For me, the college was more for the students who attended as day students who went in and out. It always made me laugh at the court students because Jack wasn't going to the college as such. He was more in the residential. And that residential really was a bit like a secure unit, if I'm being honest. It was a locked facility. He at the end of the day, the only way he could have got out of his little area was through somebody letting him out. He didn't have free access. It was the most noisiest environment I've ever been in, and echoey and banging, and so he'd have other residents grabbing things off his plate. So he'd go to get his food, and residents would walk into his room and grab his food. And the other problem was agency staff. So as things got bad with COVID, he just had people walking through who wouldn't speak to him, who he just didn't know. And Jack's had bad experience in the past where he's been physically and sexually abused by former staff. So can you imagine if you're there and you're meeting people you don't know and they're coming into your environment all the time? I always say to people, imagine being in your own living room and having strangers walking through your living room all day, banging your doors. You'd soon go, yeah. And he started to bang his head. So he would head bang in distress, and it got really bad. And we were asking and begging people to do something about it. The big problem for Jack as well was that he hadn't been there very long when COVID started. So we didn't see Jack for, I think it isn't from the documents, and I might need to check, but I think it was 15 weeks and 1 day, I think. It might have been longer. But it was many, many months. And he ended up going mute, self-harming, being extremely distressed, calling other staff members, will you be my mummy, and will you be my daddy? It was absolutely horrendous. And he ended up being put into restraint over and over during that time. He was put into endless supine restraint. It's a really hard question to answer, that one. I mean, we don't see people with lesbians as human beings to start with. We just don't. And I think the system as a whole is just horrendous. You're never going to get anywhere if you just shove people with lesbians into a congregate setting. And you can't put people in an environment like that and expect them to thrive. They're not going to. You're just fighting fires. And it's all reactive. We found it was all reactive. Everything, like with that corridor, was trying to keep Jack calm and stop him banging his head rather than addressing the fact that there's a bloody corridor and the environment's really noisy and the environment's wrong, and nobody with autism or learning disability, severe learning disability, is going to cope in that environment. I think we just need a complete overhaul of everything. It's a human rights issue, isn't it, at the end of the day? It's a huge human rights scandal, the way we're treating people with learning disabilities. We're not really getting to the heart of these human beings who deserve a life, and we need to treat everybody as an individual and cater to their individual needs. This is the big thing. They involved Jack in it. It's the first time that Jack was really included in it. So they were saying to Jack, okay, they were starting to talk to him and listen to him. And okay, he has severe learning disability, but they were still able to start to win his trust bit by bit. There's still a lot of work to do, but Jack's starting to use like a colour-coded system to show when he's feeling certain levels of arousal. They use like a pod rather than putting Jack down. So some people would call it mechanical restraint, but Jack seems to prefer it because of his past history where a gentleman used to hold him by the arms and shake him. He doesn't like to be pinned down on the floor. So they looked at his past history and said, okay, let's think of some other way. So they introduced Jack to like a big bean bag that you go down in, but they spent a long time with Jack on that, and they showed him other people going on it. They let him practice with it. They let him choose the colour. They did it with his teddy bears. Jack had a go putting other people on it, so he felt more in control. Jack chose where it should go, and it got to the point where yes, it was being used a bit, but it's got to a point now where I think it's been 12 weeks since he was last put on the pod. So it shows a huge difference, doesn't it? Because he's in control. The other thing they did was open the door to the back. He's only got a tiny back garden, but there was so much fear over, oh, if we open the door to that garden, what could he do? And all of this. So it came with, there are some people in the team who've got that more sort of confidence and more LD experience. And they said, well, we've got to give him control. And there were some staff who were frightened to give him control. But once they'd given him control, they realised that actually that's what he needed, and things calmed down, because now when Jack's upset, he has somewhere to run to, and he's got this little space in the garden where he hides with his chair. So he now runs there rather than it coming out in a different way, in a more destructive way. So a lot of it is about developing relationships are the absolute key. That they need to be consistent with consistent staff, and you need to build trust, build it over time. Know that if something goes wrong, you need to look at yourself and think, okay, what could I have done better here, isn't it? But trust is the big one, and the ability to also trust Jack is, and to go with it. You know, everyone has said, gosh, when we opened that door up, we were all a little bit afraid, but actually it's been a huge thing, because the more space we gave him, the more he's been able to regulate and calm himself. It's not rocket science, actually, but it's like
So it is a great pleasure to now hear from Vanessa Bob-Swaby. In fact, Vanessa is next to me today. I don't know if you can see. It's really good to have Vanessa. Vanessa is one of our content developers who is bringing lots of knowledge and wisdom around how we work with intersectionalities, particularly how do we understand autism and ethnicity. And we're grateful for Vanessa being supporting all strands of the National Autism Trainer Programme. Vanessa, she also has a family experience of residential special schools and colleges, and this is what she will be sharing in the next video with all of us. She's also going to be available a bit later on, along with team and other people, for the discussion.
My name is Vanessa Bob-Swaby. I'm a mother with 2 autistic ADHD young adults, and I was diagnosed autistic last year. How I came about picking a residential school for my son Nathaniel was due to the fact I felt I couldn't manage him at home, and it was a last resort, because I was forced, I would say, to make a drastic decision. It was either that, or I felt that I was going to be put on Section 47. If I can remember at the time, it was child protection, looking at the fact that I wasn't being a parent who was managing him very well. I think that why he ended up where he was because of the behaviours at home. I was struggling to parent him accordingly, because the advice that was given to me was more from a mainstream perspective. When I looked at CAMs who came into our lives for my son, it wasn't really looking at what autism was. It was more about what was happening at home. When I decided as a last resort to put him into residential, was fearful for me, because all I keep on thinking about was the horror stories you see on the news. You hear people talking about your child being sexually abused, if they can't speak for themselves. And because he was a young black boy, I felt that if I made that choice, would he end up under the Mental Act? Because you always hear about young boys being sectioned, medicated. And because Nathaniel was not being understood, because he couldn't articulate himself in a way it was wise, I figured I needed that holistic care approach, where it was all about not just Nathaniel, it was my household. Because again, as I said, I say it as it is, he was aggressive, he was violent at home, and I was fearful that he would end up in the criminal justice system. So I think taking that route, I'll look back now and say it was the best thing that ever happened. But what happened for me, which was the success of Nathaniel being in this residential school, was teachers seeing him as an individual, I think what went really well with Nathaniel being in residential was the 24-hour wraparound, as they called it, individualising the programs that was for his needs. Everybody did things in their own time. He wasn't forced to do things. They gave him choices to be made. If he didn't like it, they allowed him to phone me so that he had the voice. It wasn't me saying it, was what did he want, and I had to say yes or no. It was the one-to-one support where they allowed him to go out into the community because he started asking questions. When he started to realise that, the words were put, is that he realised he was more able than the other autistic young people in his school, was that they made those choices that he was allowed to go out into the community. Some was on his own, but he had to have a mobile phone, street safety. It was finding out the things that he liked. They invested in him. Sometimes people don't see those sides. The negativity, I would say, of when your child's in the residential, you hear the horror stories. Yes, it is out there. But the good side is if you have a good relationship with the school, the Senkos, speak to the head teachers, the multidisciplinary teams, the speech and language therapy, the occupational therapy. I never really understood what those roles were until I got into residential school, because the school made time, to sit with me so that I made sure that my son's needs were being met. If you don't have those sort of relationships with professionals within your child's establishment, you're going to find, if no one is talking, your child is the one that's going to lose out. And I think with Nathaniel, the day when he turned around and said, "Mum, I don't think I should be at this school no more," what was happening, and the school worked with me, was that they realised now, Nathaniel realised that he wanted more, but the services were not there for him. So when we talk about transitioning back into the community, he never really got that. I think I got that by me making sure that I spoke to the teachers, I spoke to the head teacher, I spoke to autistic people as well, autistic establishments, to find out before he came into the community what was out there. And sadly to say, there isn't really nothing out there, in the sense of safe spaces for young autistic people, especially at the age of 16 when he came out, when he should have come out at 19. Due to the fact he said, "Mama, the words that he used was, if I stay in this school, I think my mental health is going to be really low." But I think it may have been misinterpreted that he was being suicidal. I think he may have touched on that years ago, meaning that he just felt he had no one to talk to. There was nobody like him because he became very able, where one minute he was very aggressive, unapproachable, to a young man who now knows himself because the school invested in him. Something I would not have been able to do at home, because social services, again, I think was the biggest failures, because they don't recognise those with autism without learning disabilities. And I think that's what they need to understand, that not all autistic people with learning disabilities or without learning disabilities, they are different. And I think that's what professionals need to understand when they're working with autistic people. Find out what their likes and dislikes are. I think that is what's missing when a child goes into autistic school, is all what the professionals say or what the parents say. But with Nathaniel in particular, he was able to articulate what he wanted. If it had to be through one of his TAs, who were the ones that got him into fashion, where he would able to sit in the meeting and talk, to them, whisper to them, write on a piece of paper, and they would speak for him. And once he had that trust and he felt that certain people believed in what he wanted, he would open up and speak for himself.
We have started already hearing from our speakers about the importance of trust, about the importance of collaborative practice, about people making decisions together, staff understanding autistic mental health, understanding the social determinants of autistic mental health. We're going to continue with Alexis Green. Alexis is autistic, and her harrowing experiences that she endured for 3.5 years when she was trapped in a mental health system that couldn't support her, couldn't understand her, have contributed to her expertise today. Alexis has been misunderstood, mistreated by institutions that tried to put support for her. We do recognize that professionals come with the best intentions, and that's the reason why we want to support professionals to get it right with diagnosed and undiagnosed people. When Alexis finally got her autism diagnosis, that was only given to her after she was misdiagnosed with 6 other medical labels. Alexis has experienced seclusion, cultural, psychological, physical, and chemical restraint, and nowadays she's supporting others that going through this experience, but also in a very compassionate and calm way, she's supporting others who want to get it right, who want to break that culture of seclusion and restraint. Let's hear from Alexis, and again, a trigger warning. You're going to hear difficult stuff, but I think it's one of the ways talking about them, breaking the circle of silence, developing our understanding can help us all to do better, as we all want.
Hi, my name's Alexis Quinn, and I'm going to talk to you about, what it's like, I guess, to be restrained in your formative years at school and the kind of the impact that has. So, I can attest, first of all, to its long-term harms. But I suppose to understand these, we need to look at the full breadth of restraint practices that schools employ, which a lot of them actually go under the radar. They were sort of like just part of the system, part of the school. They're kind of embedded. So the first one is the kind of cultural restraint. So by this, I'm talking about the ways that schools promote a neuronormative meta-narrative. So here we're talking about culturally preferred ways of being. And I suppose that non-autistic cognition is superior to autistic cognition, which is often seen as kind of disordered and faulty. There's something wrong with you, is kind of the message that you get. So school teachers would often stop me from expressing my culturally preferred ways of being, stopping me from doing things that were important to me, and I suppose my autistic culture, things like making eye contact, things like, being super engrossed in special interacts, things like needing to move and not being kind of having to sort of sit still. And when I would do those things, when I would embrace my kind of culture, I was often made to sort of feel ashamed of myself or feel inferior. Sometimes I'd be humiliated because, I was very different to the others in my class. So what would often happen is that psychological restraint would be employed. Okay, so what we're talking about here is putting psychological pressure on somebody so they feel that they've got no choice to comply. So maybe threatening me with detention if I moved too much or was disruptive, not putting my hand up in the class, threatened with being removed from the class or having learning support team come down to the classroom. Often they would come in numbers so that I knew that if I didn't move by choice, that actually I'd be forcibly removed. Or maybe even making me do additional work to make up for what I had been forced to miss in the classroom. And even stuff like just shaming me like in front of the class, like, oh, look at Alexis, and also embedded in schools, in school policies, there are another type of restraint called blanket restrictions. So this is where a rule is applied to a group of people regardless of individuals' needs. So for example, everyone has to sit at a desk for X amount of time. If you miss your homework, X, Y, and Z will happen. No one can access the toilet at break or lunch, etc. If you shout out, X will happen. So these kind of restrictions, these kind of restraints actually disproportionately impact people like me because they target our very kind of ways of being. So what's the impact of this? Well, first of all, it undermines trust. Okay, it undermines trust between me and the teacher, me and other people, because I'm constantly feeling objectified, right? That damages my self-esteem, right? It causes me emotional harm. I feel guilty. I feel ashamed. I feel blamed for just being me. And it actually stops me being a full person because I'm constantly having to restrict the way that I am. I'm constantly having to hide parts of myself. So that obviously leads to poor learning outcomes, okay, and probably, for many people, exam results. Certainly, my last few years of school, I attended only about 50-60% of the time. And it wasn't because I'm not intelligent. I actually ended up with straight A's, but it was just because I just wasn't welcome. It also, and this is important, it causes complex trauma. This is these moment by moments, micro accruals of little niggly traumas that kind of chip away at your protective shield until it's completely, smashed to blithereens. And so you kind of avoid interacting with people, you become really insular because of the stigma that it creates. There's no evidence that any of these types of restraint, psychological restraint, cultural restraint, blanket restrictions, result in any kind of good outcome or social benefit. We know that they affect people's ability to connect, to trust, to make decisions, to make improvements. But actually, if we respect people's views, and avoid putting psychological pressure on them, we know that it supports people to make decisions. It helps them to develop their self-esteem, to improve their decision making, and actually to become more autonomous. Now, with regard to physical restraint, right, mechanical restraint, environmental restraint. So I'm talking about being, environmental restraint. I'm talking about being put in I was often put in isolation booths, that kind of thing. Yeah, I don't. An hour does not even an hour goes past before I think about that stuff that happened to me. Right, the fight, the sweat, the immense fear, wetting myself, the hands on me, the bruises, the utter desperation, the isolation. And the fact that there's no one to rescue me, because actually I deserve being in handcuffs. I deserve being put in isolation booths. I deserve having 10 people all over me. I have a hole. I often describe myself as having a hole in my soul. A big gap in my self-esteem, in my ability to connect, to trust, to feel any amount of acceptance for myself or feel any respect for myself. Because, I think in those formative years, you're kind of taught to hate yourself. You're scared to embrace your natural sort of inclinations. You struggle to build relationships. And all of this as an adult has led to sort of a lot of interpersonal damage, including abandonment, emotional regulation, difficulties, loss, as I said, mistrust of others, and frustrating my natural need, my human need for kind of connection and support. I remember battling with teachers, feeling punished, unheard, uncared for, and totally unable to do anything about it because I couldn't change myself. I couldn't change the way that I am. And I admit actually that I have a distrust for practitioners now, for those representing, the system, and express at times a hopelessness. I'm definitely sometimes feel hopeless about positive systemic change. But I would say to you that if you want to help, you need to consider and acknowledge and understand the trauma of restraint, all sorts of restraint, and its potential impact, long-term impact on individuals, classroom dynamics, inequalities, and well-being. Thank you.
Powerful stuff from Alexis for all of us to consider. And one of our key missions at the National Autism Trainer Programme is to create a safe space where professionals for us to create a safe space where professionals can celebrate and strengthen what really works. They can learn from each other about good practice, but also they can reflect in honest and authentic ways about their personal and service culture and about what might create or exacerbate issues around behaviors of concern, why autistic people might feel outside of their window of tolerance, and what tools do we have nowadays to understand our behavior in relation to behaviors of distress that autistic students may be experiencing. Without further delay, I'm going to introduce now Hannah Otto. Hannah is also a content developer for the National Autism Trainer Programme, and she's also the CEO of a charity called Send Parenting. Send Parenting is one of these charities that are creating meaningful links for people from different cultures in the UK in order for parents to find support, to listen to each other. Over to Hannah, which is going to talk to us about her experience with residential special school.
My name is Hannah Otu, and I'm a mom of two. My son, who is the youngest, has got a diagnosis of autism, and he has high level of needs and has various behavior that really needs monitoring. He needs 24 hours constant supervision. And because of that, as he kept growing and was getting through the teenage years, it was so difficult to manage him. It was difficult within the house for just my husband and my daughter. So because of that, we had to seek more support and enroll him in a residential special needs school. Our experience throughout the time he was in residential school, and what I would like professionals to know, is that it's quite difficult for families, although we know that we do get the support and 24-hour holistic care in residential schools. It gives us a break, but because you have had your young person with you since birth, since childhood, and the family has a close bond among the special needs person, their siblings and their parents, it's quite difficult emotionally when that bond is broken and our young children go through the residential schools. It's not only on the side of the families, it's also on the side of the young person with autism and special needs. They are used to a lifestyle with the family for years, with their siblings, where they have a bonding, and then that bonding is broken where they have to go into residential school and then have a new system in place. And mostly, maybe the system might not be as relaxed or very personalized to what they know. So that creates a bit of difficulty for the young person as well. And for the family, it's a bit of an emotional stress. So it's good for professionals within the residential school setting to work very closely with families so that they could also share ideas of what has worked very well in the past and what didn't work well and how they can move forward. And also for schools and professionals to know that parents are real aspects of their young people because they've been with them for years, and also give opportunities where families could work with them as a team to continue to design an education, care, and holistic system for their children and young people. The residential school setting might be a bit rigid for some of the young people, although it is set up in a way to support young people with more holistic and therapeutic needs. But it's sometimes a bit more rigid for them, and they will have to share similar environments with other young people, which might not be so tailored to the individual's needs. And the young person will have to get used to sharing other things, which in a way is good, but also in a way you might not have the very, very individualized or highly personalized environmental system for that young person. So that is why it is always very important to have those links with families and other teams to create a system that works for the school and also during the holidays when they go home, so that there's a more holistic system when they come home and back into the residential setting, and to create something that would be much more easy for the young person to transition from both settings, because that will really help them in terms of their autism and their future development.
Anna made lots of points about how do we support young people and their families with transitioning, with holidays. This can be really, really difficult time for autistic young people managing transitions, as well as, sorry, Becky, I will have to mute you for a sec. I get some return. How do we personalize the care, the educational and care plans in residential special schools? How do we work with families? And what about siblings? How do siblings experience, and what kind of holistic support we can think of? All of these are key topics in the curriculum of the National Autism Trainer Programme for residential special schools and colleges. Next, I'm excited to have today live here with us Becky Gillespie, who is a UK lead for ICARS. ICARS stands for International Coalition Against Restraint and Seclusion. Becky and her team have been doing really, really heavy work around supporting our understanding about what needs to change and what are the experiences of hundreds of people across the UK. Nowadays, there is a growing body of evidence and a worldwide movement calling for the elimination of restraint and seclusion from educational settings for anything other than that being the last resort as an emergency measure to prevent imminent serious injury or death. Very often we know that's not the case. We know that this might even become business as usual for many schools. And ICARS has a heartbreaking, recently, I think approximately a year ago or a bit less, Becky will tell us, ICARS has produced a report with approximately 600 families with lots of heartbreaking evidence about not only the harmful practices, but also the long-standing impact that these practices may have. Over to Becky about why this training is needed in her experience.
A little over a year ago, a local authority SEND inclusion officer took me on one side and said, "Becky, have you ever considered a residential school setting for your child?" They were talking about my youngest child, who was 10 years old at the time, care experienced with a degenerative physical disability and autistic. I was able to say no. I had the resilience, the support around me, and the confidence to do so. But what about those parents who don't have the option to say no, who literally are on their knees and require more support than an educational day placement allows them, or whom, like my son, the local authority are unable to find an appropriate day placement and so look to residential to fill a gap in provision within the family's own community? What are they faced with? What too often does it feel like for parents when they consider the possibility of a residential special school? We've all seen the media reports that roll out at horrifyingly frequent intervals. Just this year, there has been extensive reporting on the abusive practices that were eventually taken seriously and uncovered in full at the residential special schools run by the Hesdy Group in Doncaster. Practices that were only uncovered after it's reported. Ofsted had received 108 reports of serious incidents, and 232 referrals were received by Doncaster Council's LADO. In addition, whistleblowers had shared concerns with authorities on 20 different occasions. The Child Safeguarding Practice Review Panel looking into these residential schools revealed a culture of abuse and harm, including evidence of physical abuse and violence, neglect, emotional abuse and sexual harm. Evidence that medication was misused and maladministered, and an overuse of restraints and unsafe and inappropriate use of temporary confinement. Such appalling events surrounding residential special schools need to become a thing of the past. Such horrifying realities for too many disabled children must cease. The independent inquiry into child sexual abuse identified that pupils in residential special schools are amongst the most vulnerable children in our society. Disabled children are almost 3 times more likely to experience sexual violence than non-disabled children. And as we know, this is not just true of sexual violence, but also forms of abusive practice. Everything that can be done to stop the institutional and societal abuse of children in these settings needs to be done. And that is why I'm so pleased to be here today, supporting the launch of the National Autism Trainer Programme as it is rolled out into residential special school settings. As Georgia says, my name is Becky Gillespie, and not only am I mum to 5 children and young people, 3 of whom are neurodivergent, with almost 30 years' experience in fostering and adoption, I'm also the UK lead for ICARS, the International Coalition Against Restraint and Seclusion. Now, ICARS is a group of parent, survivor, and neurodivergent-led volunteer advocates who work internationally, championing the human rights of all children. It is our belief that every child deserves to feel safe in every environment. School is where children spend much of their time, and where this is a residential school, this is even more true. It is our opinion that staff within education environments need support in order to create safe and compassionate environments that will enable themselves, their colleagues, and their students to thrive. And unfortunately, the use of restraint and seclusion in schools worldwide, including within the UK, has been and remains a danger and a threat to this ideal. We at ICARS hear from families on a daily basis whose children have been traumatised through the use of restraint and seclusion whilst at school. We believe that if professionals have a deeper understanding of their behaviour, time to rehearse their plans and demystify what neurodiversity affirming practice is, this can eliminate harmful practices. It was just in March this year that we released the ICARS Report England. Now, the ICARS Report England documents the lived experience of 560 English children who are subjected to restraint and or seclusion in their school settings. And their case studies were collected over a 12-month period. Hannah, can we have, we've got the first slide, thank you. The ICARS data demonstrates that it is disabled children who are disproportionately affected by the use of restrictive practices in schools, including residential special schools across England. Surveys were distributed widely across social media, and did not target any specific populations. However, 93% of respondents reported that their child had a diagnosis that impacted their educational needs. A further 4% of parents said that their child was awaiting a diagnosis or they suspected that their child's needs may warrant a diagnosis, whilst only 3% of parents whose children had been subjected to restrictive practices in a school setting reported that their children had no diagnosis or suspected need for a diagnosis. And so the ICARS data is almost exclusively populated by children with special educational needs and disabilities, even though only 16.6% of England's total pupil population has SEND. Importantly, we discovered that 81% of the 560 children and young people who had been subjected to restraint and/or seclusion in their school setting who responded to our survey were autistic. Collectively, the 560 stories expose an educational system which has failed children with devastating consequences. The consequences are clearly outlined in our report, which includes quote after quote from parents speaking of the immeasurable harm that they can see that their children have experienced through the use of restraint and seclusion against them. And, more often than not, those being failed are children who are neurodivergent. ICARS surveyed respondents to determine the type of educational settings in which their child or children have been restrained and/or secluded in. For a number of children, restraint and seclusion had occurred in more than one type of setting. The respondents were asked to describe the setting in as much detail as possible, and the settings involved varied hugely, from mainstream to residential special schools, schools for those with high support needs, settings for autistic children, SEND settings and SEMH settings, local authority maintained schools, academies and independent settings. The use of restraint and seclusion in our schools, despite the well-documented harm that it causes, is widespread. It was in 2019 that I first heard ICARS founder Zoe Reid talk about the normalisation of restraint use, and this is undoubtedly what the ICARS report bears witness to. Within education, restraint use against disabled children is prolific, and it is system-wide. Nearly 40 years have passed since British state and publicly funded schools abolished corporal punishment. Yet the ICARS report highlights the awful truth that disabled children across England continue to be exposed to aversive behavioural modification approaches designed to shape and correct behaviours born of physical, neurological and developmental disabilities. And these behavioural approaches are leading directly to the use of restraint and seclusion. Such behavioural interventions fail to address the needs of disabled students who will be better served through accommodations or reasonable adjustments, in the same way that eyeglasses are more appropriate for nearsighted students and inhalers are more appropriate for students with asthma compared to behavioural interventions, so too are sensory, social and educational accommodations more appropriate for students with developmental or invisible disabilities. It is very clear to us at ICARS that widespread reform is needed. But how is that reform to be achieved? One of the key findings from the ICARS report was that funding and support are needed to train educators in how to change practice to a trauma-informed, disability-affirming model in order to foster widespread reform. We recognise that the residential school sector is one that carries with it increased levels of risk, and yet it needn't be this way. The reality is that there are many educational staff who are completely committed to the children in their care, but who are unknowingly endangering the children in their care and themselves by utilising restrictive practices. Many educators and paraprofessionals are taught and thus rely on restrictive methods in educational settings, despite its inhumane and counterproductive nature. This is because too often restrictive practices have been and are presented within the industry as effective best practices. Without insight into the harm being caused and the risks being assumed, staff are lulled into a false sense of security when they attempt to gain and maintain control through restrictive practices. A narrative of them versus us has emerged that characterised children with disabilities as angry, aggressive, entitled, and in need of being managed behaviourally to protect staff and other students. The experiences of families detailed in the ICARS report shines a light on a system which has failed to honour a commitment to the children it is duty-bound to serve and educate. Parents and carers' testimonies describe having to remove their children from educational settings to protect them from enduring mental and physical abuse as a result of restrictive practices, restraint and seclusion. Vulnerable children are being forced into education environments that not only fail to provide them with their legal rights to educational services, but actively causes harm to their well-being. The ICARS report England proposes that culture change that involves eliminating restraints entirely, other than in situations which are true last resort, across the education sector is necessary. We advocate a two-pronged approach. Not only are funding and support needed to train educators in how to change practice to a trauma-informed disability affirming model in order to foster widespread reform, but this cultural shift needs to run alongside effective, meaningful legislation that ensures disabled children are delivered an equitable education that is in line with their non-disabled peers. You cannot punish disability out of children in the name of good order and discipline. And here I make reference to the words of the Education Inspections Act of 2006 and the use of reasonable force guidance of 2013. But you can change the way that staff work with neurodivergent children and young people within settings. You can increase knowledge, support, and accountability. Currently, in residential schools, there is a hodgepodge of guidance and legislation that staff are required to follow. Much of it is confusing, little of it is truly aspirational, and in the main, it is down to individual interpretation. A common theme that runs through the guidance is that there are no definitions of words such as exceptional circumstances, necessary, and proportionate. This means that the rationale for the use of restraint on any pupil is left to teachers or caregivers' professional judgment, which is heavily influenced by individual school cultures. In ICAR's experience, inappropriate restraints are often characterised by people who carry out the restraints as both necessary and proportionate. And so without more robust safeguards, more knowledge and more understanding by staff of the children they seek to serve, then restraint use will continue to be normalised, restrictive practices will continue to be deemed appropriate, and children will continue to suffer ill treatment. And so we come to the training being launched into the residential special school arena today, training that brings with it hope. The National Autism Training Programme is grounded in trauma-informed and experience-sensitive approaches that are asking staff to look deeper into everyday provocations, their own biases, their own needs and well-being, as well as understanding in depth autistic behaviour and creating personalised, humane plans for everyday life, rather than targeting behaviours. This is what staff need in order to enable change. After Hesley, Education Secretary Gillian Keegan made a statement in which he said that the government will continue to work closely with the sector to make sure that children are not only safe, but fulfilling their potential. Yet we know that the use of restraint and seclusion against disabled children in too many settings continues, and its use is prolific. It is so harmful, and it prevents children fulfilling their potential. The recommendations from the Child Safeguarding Practice Review Panel urged government departments to work together to transform the education, health and care offer so that children with disabilities and complex health needs thrive and are supported to achieve. We see in the National Autism Trainer Programme an example of an initiative that is designed to make this happen, and for that we are grateful. As parents, we want our children cared for in a culture that is open and transparent by staff who understand our children and are empowered to speak up for our children when things aren't right. We want staff who are compassionate, nurturing, well-trained and well-supported. And because they are well-trained and well-supported, staff will know when they don't know and will be prepared to ask for help from people who can help. It is our hope that the National Autism Trainer Programme will be a tool in the toolkit of specialist residential schools across the country to achieve just this, a proactive way of changing service culture and service mindset. Within the ICARS report, we were clear that systems to eliminate restraint and seclusion from our schools need to be informed and endorsed by neurodivergent and otherwise disabled people. That is why we are excited to see this innovative training co-designed, co-produced and co-delivered with autistic people being funded and further rolled out into the education sector by NHS England and the Department for Education. We thank you all for everything that you are doing to create meaningful change.
Thank you so much, Becky. So myself and Dr. Ruth Moyse, we have been working with over 60 autistic experts by science, experts by experience, who are both in order to create a curriculum that can help professionals to gain an understanding of autistic mental health and barriers experienced by autistic people. During the training, if you're a member of staff in a residential, special school or college, you will hear Ruth and discuss examples of existing good practice, innovative approaches of working with rather than on or for autistic individuals. And much of the focus will be how to respond in a calm and humane way to behaviors of concerns in order to reduce restrictive practice. It has been very, very important to examine and to put into our curriculum frames that work for all. Frameworks that are neurodiversity affirming and are also related to the well-being of everyone concerned. We cannot have happy, healthy students if we don't have happy, healthy staff. So today, it's really nice to have with us one of our autism trainers who has been also training across different strands, Tristan Kluiben-Scheidel, who is going to give us an overview of what a collaborative, experience-sensitive and trauma-informed approach means in the context of the National Autism Trainer Programme. Tristan, over to you.
Thanks very much, Georgia. Appreciated. Good afternoon, everybody. Hope you're finding the presentations helpful and informative. As Georgia said, my name is Tristan Kluiben-Scheidel. I'm one of the autistic core trainers from the NET programme, and I currently deliver across a number of strands. I've been doing so since March and thoroughly enjoy delivering the courses. I just wanted to tell you a little bit about how we frame our work and training using collaborative, experience-sensitive and trauma-informed approaches. So, with regard to the key aims of the programme, is to foster respect in differences of neurodivergent people. The programme reframes the negative and the limiting perceptions of the autistic community and puts autistic voices at the heart of the programme, with delegates engaging, exploring and amplifying the narratives of autistic people. All of the material in the programme have been made in a truly collaborative way with autistic people working together with neurodivergent team members and other allies as well. Next slide, please. Collaborative practice really is at the heart of what we do, not only with the co-production, but also with the co-delivery by neurodivergent people like myself. Our values and approaches are simple, and they encompass curiosity, compassion and care, relationships, trust and respect. And every part of the process has been owned and shaped by a partnership of equals, including respect for skills, the experience, and adapting to the best ways of working with autistic and other neurodivergent team members. Next slide, please. So the collaborative team includes real accounts and lived experiences from those who have experienced inpatient and outpatient care, and from parents and carers of neurodivergent people, and from neurodivergent academics as well. With the co-delivery, delegates are trained by a partnership of autistic and non-autistic expert trainer facilitators with the lived experiences, and by other neurodivergent experts, by science and academics as well. Delegates join the programme as experts within their own services, and will have reflective activities as well as discussions and learning to deepen their knowledge and to help evoke that positive change. Thank you. Ongoing support, delegates as well as EBEs will have access to a bespoke e-library with various resources, with articles, recent developments, and research. Delegates will be invited to join the regular codes of practice events that are run, and teams will get advice from each other and hear guest talks by autistic experts as well. There'll be shared learning experience events with expert guest speakers and opportunities to discuss key topics and share best practice that's already out there. It's right to say that a lot of thought, planning and commitment has been given to establishing ongoing training, development and support, and safety and well-being to the delegates and the EBE trainers themselves. Next slide, please. During the programme, delegates will be able to discuss, they'll be able to explore with facilitators a number of different dimensions of named frameworks, together with the practical use and the application of them as well. The NAT trainers will train the NHS staff, who will then connect to our pool of experts by experience, EBEs, trainers who will help them co-deliver in their trusts and help add real value and content to the training by sharing their knowledge and their experiences as well. And as mentioned, there's this really active community of practice that's being very well received to support staff to keep growing their skills. And a link to that, I understand, will be put in the chat today. Next slide, please. So at the National Autistic Training Programme, mental well-being is paramount for everybody. And one of the approaches that we use is the experience-sensitive approach. Autistic people are acknowledged and validated as experts in their own experiences, and their expertise is valued, it's listened to, and it's responded to in a way, in an approach that's sensitive to those experiences. And there's a shift in mindset and culture throughout the course, away from the fixable behaviours, or so-called fixable behaviours, over to one of curiosity, to one of relationship building, trust building, strengths, and meaningful engagement within clinical and educational environments. Next slide, please. Research suggests that a majority of autistic people actually have diagnosable levels of post-traumatic stress. And reasons for this may be accumulative combinations of a variety of things. So years of pain, perhaps from sensory overwhelm, searing pain from medical interventions or restraints that we've heard about, neglect, enforcement of neurotypical behaviours using punishing procedures, bullying, victimization, isolation, sexual abuse, death or abandonment by a deeply loved one, or the accumulation of microaggressions that Alexa spoke about, because we know autistic people experience events differently to non-autistic people, and the same negative event can be traumatic for an autistic person, but may have little impact on a non-autistic person and be dismissed or minimized, which causes further harm. Next slide, please. A trauma-informed approach recognises all of these things, and that distressed behaviour is an understandable response to trauma, and it's not something to be glossed over or diminished or extinguished from view. Many are terrified of being restrained because of past memories, or from suffering, perhaps extreme pain or joint pain from co-occurring hypermobility, which all add new levels of to that traumatic experience. All training that we give in the NET is informative, effective and evidence-based, and he's centered around a truly trauma-informed approach. Next slide, please. Thank you. So understanding trauma calls then for enabling a feeling of safety, of respect, and in building trust in relationships and truly caring environments for those individuals. It involves enabling soothing, finding ways to help achieve self-regulation, of finding a calmness and a happiness, and to find the best paths for healing for those individuals. It should consider sense making, i.e. making sense of what has happened and why it has happened, and how perhaps to mitigate or manage that from happening again going forward. And it involves identifying the best and most appropriate therapies possible for that child or young person as well. Next slide, please. Thank you. So, in summary then, the aims of NET are to portray and highlight that autistic lives really are equal and worth living and can be fulfilling and joyous. It fosters the real importance of that collaborative approach, of being neurodivergent affirmative, of having caring teams which are built on that mutual trust, respect and understanding. And it also encompasses the use of the best possible modern research, combined with the autistic expertise and input, which is actually truly valued and listened to. And in turn, that informs excellent outcomes, enabling autistic people to live their full and authentic lives. A whistle-stop tour. Thank you very much for listening.
Thank you so much, Tristan. Very nice to have you today with us. So once you register to the National Autism Trainer Programme, you will hear more about understanding the value of modeling collaborative, relational and person-centered values. And you will have time to process these, to understand how you will present them to your colleagues and how you can work out this with the autistic people that you support. You will practice how to facilitate the delivery of our slides, of our animations, the videos, all the rich kind of content that we have prepared for you, so that you have a curriculum that can be flexible enough for you to take back into your service and support your colleagues. You will also be supported to work with autistic experts by experience. We're going to have a break now for approximately 10 minutes. And when you're back, you're going to hear more about the professional perspective, what professionals are telling us about what the training can and should offer to people who work in residential special schools and colleges. But also you will have a chance to hear from our project managers and administration team about how we aim to support you from registration throughout the training and joining community of practice and other seminars for free. So let's come back 7 minutes after 2. See you all very soon. Thank you. In this next section of our information session of the National Autism Trainer Programme and its new strand for residential special schools and colleges, we're excited to have 3 speakers who have lots of experience, lots of expertise. They represent the professional side of things, and they bring lots of hope in the field with their innovative and humane work that they're doing. So the first one is Danielle Dunlop. Danielle, thank you so much for being together in this one. Danielle is representing Oasis, an organization that works with the Ministry of Justice and is creating England's, to my understanding, first secure school for youth offenders, and they're currently working to create a therapeutic model for young people who are in custody. Danielle, very nice to have you with us, and over to you.
Thank you. Hi, everyone. So as Georgia just said, I'm Danielle Dunlop. I'm here from Oasis Restore. We are the UK's first secure school. And the hope, I think, is that we will eventually replace young offenders institutions as we know them. But at the moment, we are a proof of concept. So we're still in development, aiming to be open in spring next year. So we're registered, we're in a bit of a kind of a conundrum, I guess, because we're registered as a 16 to 19 academy, but we're also registered as a secure children's home. And the type of provision that we'll offer will probably replicate that more of a residential special school. So we're in a mix at the moment. We're in a ground between youth justice and education, but we're not funded by DfE at all. We're Ministry of Justice funded. So our overall vision is to create a therapeutic environment underpinned by the cornerstones, our 3 cornerstones of relationships, community, and discovery. And it's been so wonderful to hear this afternoon, everything that everybody has been speaking about just resonates so much with everything that we are trying to do, without knowing, I guess, that what we're doing is best practice, but it just reaffirms everything that we're trying to do. So thank you so much to everybody. Next slide, please. So we know from current data, although it is largely inconsistent across the youth estate, that the cohort of children coming to us will be largely neurodiverse. Lots of our children will have experienced school exclusion, and as a result may have experienced missed opportunities for diagnosis and therefore support. Our approach to inclusion at our school, and it will be considered a school, education is very much at the heart of what we're trying to do. It will be one of full inclusion. So we're looking at tailoring our environment as closely as possible to the individual strengths and aspirations of each individual child. We're not singling children out. We're not delivering ad hoc one-to-one interventions, but actually by the nature of how we've designed our environment, our curriculum and the support, we're able to provide the safety and stability needed for our children to truly thrive in conditions and in environments where they used to not thrive, essentially. And at the moment, we know in the youth estate, children are not thriving, and reoffending rates are really, really high. We know there's a great need for educational staff and all staff across our establishment to gain a modern understanding about autism, beyond a disorder narrative, and understand how students perceive the world, what can help them regulate, and how staff can co-decide with students reasonable adjustments to prevent autistic burnout. It really takes trust and time for this to happen effectively, which is why relationships for us are so important in everything that we do. It's about changing mindsets and schemas for what professionals have learnt previously and adjusting that to what we know now, and how much better for the individual if we focus on their strengths and remaining curious about the parts of the day they might struggle with and how we can support with that. We wouldn't really be able to dig into the co-creation piece with our students if they don't feel safe, for one, and two, if we don't have the relationships with them. So we'll work really, really hard throughout the children's induction process to build those positive relationships. And part of our training model for all staff will be training into how to build relationships, because we understand that our staff will have different experiences themselves and come from lots of different backgrounds. Staff working with students 24/7, they'll be with them all day, every day, 365 days a year, if that's how long they're with us. For those children who have a history of behaviours of concern and or young offenders, although we're not calling them that in our environment, staff may not always understand what drives student behaviour or the invisible stresses in the environment. This way, things may escalate. Understanding behaviour as a form of communication, and through the lens of discovery and curiosity, we begin to work out what the drivers are for this behaviour, where they've come from, and in doing that, we can change within ourselves as staff and our environment what we offer to them to make daily living and learning an experience that they are able to engage with in a positive way. We often hear from staff, this child doesn't engage or they're difficult to engage. But what we need to think about as staff is actually, what is it about what we're presenting to children that's difficult for them to engage with? So it's much more about, us as staff, what we can control and manage. We need to do that with the best interests of the children at heart. If we take the emotion out of responding to behaviours that can be challenging and violent sometimes, this takes practice and can be difficult. But if we do this and we approach behaviour with containment and curiosity, it's much easier to get the underlying messages behind the behaviour. This is really the root of what we want to know and what we want to support. However, it doesn't always work and it can be difficult to implement. Many staff members have experience of parenting, education, their own lives, how they were brought up, that sometimes conflicts with the less punitive and more restorative approaches to behaviour. So it all feels a bit unnatural, even for those staff with the best intentions. I've heard the terms, and in my previous role, not in this role, but I've heard the terms, oh, we're just letting them get away with it. We need to do something about it. I've heard those kind of terms more times than I can count when discussing how we manage behaviours that challenge us. Add to that the very complex and threatening violent situations staff will encounter. These may engage their physiological responses, the staffs I mean, meaning that staffs themselves are not regulated enough to present as an attuned and co-regulating adult. This training offer will be crucial to giving our leaders and middle leaders the understanding and tools to be able to cascade the best practice. It also complements our ongoing staff support and development model. So we're able to look after our staff and to provide a space to take a deep look at ourselves as practitioners. We're offering fortnightly supervision and fortnightly reflective practice. So we can really delve deep into see where things are going well and crucially, where we need to take a different approach as the adults who are supporting our children. We'll provide this all within a safe, open and transparent environment with the needs and experiences of our children at the heart of everything that we do. Staff have the best intentions, as we know, but may not always get it right. And it's our duty to offer high quality training. We're so pleased that this training is completely co-produced and co-delivered by autistic people and sometimes their family members too. This will give us a really unique opportunity for staff to engage with autistic narratives and understand the role that they can play in making a system less scary for students and their families. It also aligns with our co-production of those with lived experience in youth justice, and that's really something really important to us as we continue to develop. As a kind of startup organisation, we have a unique opportunity to be able to deliver staff training as a part of our onboarding of staff before children join us. So we should have a period of 6 to 8 weeks where we can just purely train our staff in our operation and our kind of culture. So what we're hoping to do is by doing this, we have a much better chance of getting it right from the start and building that positive, inclusive school culture that we hope will provide a structure and a concept for other youth justice organisations to learn from. So we're really, really looking forward to being a part of this project. I can't wait for it to get started. What we're hoping to achieve from this is a gold standard of support and inclusion, not just for the youth justice and secure estate, but also for education more generally. So we're really able to meet the needs of all of our children, so they're understood and supported, and therefore much less likely to reoffend upon release, but also so that they are equipped with what they need in order to continue their education and training, or whatever they choose to do back within their communities that they return to. Thank you very much.
Thank you so much, Danielle. And we will speak again with you, and we will join forces for the health and justice strand that we're going to launch in a few weeks' time. So thank you so much for your contribution here as well. Next, we're going to hear from Professor Andy McDonnell. We are excited to have Andy with us. I'm going to mute Andy for a few seconds as he's settling to his chair. Hi, Andy. I have muted you only for a few seconds. It's going to be the floor yours in a while. It's exciting to have Andy with us. He's a visiting professor at University of Birmingham. He's a clinical psychologist, director at Studio 3 Training Systems and Clinical Services. Andy has served the field for many, many years, and he has published really important research, really the evidence base that puts together so many of the things that we will be exploring at the National Autism Trainer Programme. Andy is going to talk to us about the importance of low arousal. As I said, he has done tons of research with massive clinical applications. Over to you, Andy.
Well, thank you, first of all, Georgia. That's a very kind introduction. I'm a clinical psychologist. For those of you who who know about mine and my colleagues' work, I refer to myself as a psychologist, but probably also a campaigner. I spent my career trying to work on the eradication, not the reduction, of restrictive practices. And I'm really excited that we're involved with this national project. I think it's a really important development that we start to get true autism-informed knowledge that's based on co-production. It's just essential. It's not the answer in its own, but it's a really good building block. So my part about this programme, just some reflections really on the work we do. Some people will be familiar with the low arousal approach today. I'm not going to go through those kind of ground, but this is a reflection as a practitioner of some of the key things that we sometimes forget, particularly in residential schools and special schools as well. And one of the things I would start with, first of all, is that fear and stress permeates everything. Not just the fear of pupils, but their fear of us as well. And particularly with people with autistic experience, often describe this. And we know that some of the people that people support are traumatized by previous negative experiences. Quite often, most people who are traumatized feel out of control and have a need for control. Control is something that should be a battle between a pupil, an individual, and staff. It's not an idealistic statement. It's basic fundamentals of understanding trauma. You need a sense of control. We also know that from the evidence base and from experience that unpredictability of people we're supporting can also be an issue. Unpredictability of staff and pupils. So to create a safe and regulated environment requires us within a low arousal approach, not just to look at these micro skills, but also to look at our own behaviour. To give you an example about our own belief systems about behaviour, some estimates vary, but they kind of consistently come to around 60 to 70% of all behaviours are triggered by us, not the pupils, not the people with autism. And I think that figure should be quite damning for people when they reflect on these programmes. I've heard our colleagues today, some fantastic speakers. I don't want to list them all, but it's been really impressive to hear, and our last speaker as well, talking about reflective practice. It's the cornerstone of our work. We only learn by trying to prevent mistakes and try to understand that we are active participants in behaviours of concern. We are not passive observers, as some rather narrow behavioural models would have us believe. I think the other thing as well is that when we look at our own beliefs and this cocktail around low arousal, in residential settings, quite often the children, I'm very interested in our previous speaker, will develop reputations which quite often are not deserved. But it's very hard when you're a frontline member of staff or a teacher or a coordinator to not divorce that reputation and that fear from it. So I would like to use one part of that point to say is that in my work, fear is okay. Fear is an acceptable term. It's a term I'd like to hear more in supervision and other sessions from people, because sometimes we can be put in very fearful situations. I'm somebody who's globally referred to as somebody from the University of Life. Some of the most fearful situations I've been in have been in care environments. So it's just a word when we're looking at this reflective apart to a low arousal approach, which is part of the programme and quite a cornerstone of it, is it requires us to reflect and think. And for participants on this programme, we're going to be encouraging even more active reflection, not just on best practice, but on some of our worst practices. That's how we've got to learn. Next slide, please. So cornerstone again of our work is understanding. I've used the word autistic people in experience. I would not be as pejorative to have a license to claim that complexity that is autism. A colleague asked me recently, as a visiting professor of autism studies at Birmingham City University, do I like the title? And the answer is not particularly, because I think it's such an incredibly complex, entire, chaotic subject matter. But there are some things that we do know from our evidence base, which is going to be in the programme around autism. You know, my colleague Peter Moonen comes up with, for me, one of the best functional definitions of around autistic experience, and also trauma to it could be applied, which refers to chaos and uncertainty that can overwhelm people with stress and anxiety. Unpredictable, chaotic worlds, where individuals are really, really struggling to regulate their own behaviour, and also other people may be struggling to regulate their behaviour with them. We also work with individuals who can mask this, particularly a lot of, not just exclusively young women on the spectrum, but where people appear to look calm, and then people use terms like explosive meltdown. I was talking to somebody recently who said that there was no triggers or antecedents to this young man's behaviour. He just blew up. My argument to that is there are a lot of these antecedents and triggers that are internal: stress, worry, fear, panic. You just don't see that. What you saw was the byproduct. And often when people are hard to read or judge, we often use these phrases a lot, using terms like meltdown and explosive meltdown, which again is some of the dialogue on this program that people really will have time to reflect and talk about. We also know that people have very different coping strategies. Stress is quite an important term for that. I prefer to use the term stress rather than anxiety because stress is transactional in nature. We talk about stress being contagious, but actually the most important thing with stress, which we're all exposed to, is our own coping strategies for coping with it. Some of us have adaptive coping strategies and some maladaptive coping strategies. And I'm not going to mention maladaptive coping strategies such as a bottle of red wine, for example. Not good for your well-being long term, but it still could arguably be a coping strategy, just a negative one. I think the key thing about the low arousal approach I want to point out to is from my colleague Bo Elven, who is an amazing Swedish practitioner. If you ever get to read some of his work, which is quite a lot of it's written in English, Bo talks about emotional contagion as being important with the low arousal approach, that contagions are emotion, people's fears, their reputation, but also the chaos. And I'm quite interested that people that we support experience can also be contagious to us and vice versa. So part of this approach is a very positive approach to saying a can do. If we can create a safe environment, people feeling safe, then learning and positive change can occur. Next slide, please. So I can keep coming back to this all the time. People think that low arousal is all about learning some techniques, how you stand, tricks about calm, reducing demands. All of these things are good things. But actually the core part of it is challenging our own belief systems. You know, one of the core beliefs that I will put up here is that we have an interventionist culture. I put up here things like PBS and CBT. They're just other examples to be put there. I could even jest at psychotherapy as well. We try to have this fix-it culture where we want interventions to fix behaviours. And the problem is many of these models don't take into account the abuse of people who are autistic, and also the fact that in the neurodiverse world, people are different. They're not broken versions of us, to quote Jim Sinclair. So when we're looking at the low arousal approach, which is core to the National Autism Training Programme, we're going to focus on teachers and staff to really focus on their own behaviour and how they can create calm and regulated environments. And to create calm and regulated environments, it always starts with the first criterion, which is us, not them. Yeah. Some of those examples around these core beliefs need to be challenged. Yeah. All the time I hear in my job, somebody's doing it for attention. Somebody's doing this behaviour. It's what I call this nanny 911 culture. Most of this stuff doesn't reflect the complexity of the people that we're supporting. And actually, I think it's disrespectful to sometimes use simplistic explanations for people's behaviour, because simplistic explanations lead to simplistic interventions, such as conscious sanctions and other consequential-based interventions. So a big part of the low arousal approach is to learn techniques about keeping calm, regulated environments and co-regulation, but it is about changing cultures and changing cultures from the top down and the bottom up. You know, we need to have shared belief in systems. A simple example is sometimes accepting that the person I'm supporting actually is quite complex, and that's okay as a word. It's not okay to oversimplify. It's better to actually acknowledge and embrace and accept that a person is different from me, and maybe I don't have a full understanding and never will of all the things that motivate their behaviour. Next slide, please. So really, the cornerstone of the whole low arousal approach is stress reduction. Stress reduction that's co-regulated. You know, sometimes we will do interventions with staff, teachers, pupils that really focus on their own reflection, their own regulation. Yeah. But there are other strategies that we mentioned in the programme that are evidence-based around the use of cardiac exercise for co-regulation, mindfulness-based strategies and other methods. But I think the key term, and I'm writing about this more recently, is it is about arousal regulation. Sometimes people misconstrue a low arousal approach as keeping everything quiet and calm and having no challenge for people. It's actually more about arousal regulation. And within that, it's about where our sweet spots are, because where we are regulated, we create things that actually are opportunities for learning. One of the analogies I'm using more recently is the Goldilocks zone. That's a phrase we use quite often for where we're looking for exoplanets. Where's the Goldilocks zone where planets may exist? Well, there's a Goldilocks zone that we start creating around arousal regulation. And that involves a collaborative approach to the fact that stress reduction isn't just for the people we support, but it's for us as too. Last slide, please. Thank you. So part of this whole bit and the excitement about being involved with this program, and I am genuinely excited to be involved with this program and honoured, actually, to say the least, is that to create arousal and co-regulation, which has got to be central to the approach, we've got to consider that arousal regulation in teaching environments has to represent somebody's emotional state. To give you a good example, when is someone's sweet spot for learning? If you're someone that's a night owl, your optimum period for learning on average is in the afternoons, not the mornings. If you're someone that gets up early in the morning and has a lot of sleep, your sweet spots are mid-morning. So we've got to use some of the science in that way to create these teaching environments that actually optimize success. And the other thing is to create this safe and small group opportunities for people to learn. I was actually recently at some schools overseas in Denmark where you either have one-to-one teaching or you have small, they are quite small classroom-based encounters. We're recommending that people have more dyads, where an autistic individual or young person can learn with another individual, almost as co-production role modelling. So we've actually put a separate stage in it. But I think overall for us, I would say that the challenges of this programme is it's long overdue and it's an exciting development. And I really, really, really do look forward to seeing what the learning and the outcomes are from this programme in the future. So thank you very much for allowing me the opportunity to speak today.
Thank you so much. And it is really, as Andy said, about shared intentions, stress reduction, and really the program is advocating for things that are not and shouldn't be unique to autistic students. We're advocating for things that are good for all, are good for staff, students, their parents. Thank you so much. Okay, if we go to the next slide, please, then you will see that I'm about to introduce Amanda Allard, who's the director of the Council for Disabled Children, National Children's Bureau. We are excited to have Amanda with us today, sharing why this training might be important for professionals and residential special schools and colleges. Thank you, Amanda, for being with us today. Over to you.
Thank you very much indeed. So if we can go on to my first slide. So I did rather facetiously, and I can see that Anna Freud thought better of the title for the overall title for my presentation, which is Why Restraint is Bad, which might sound facetious, but I think it's really important to start there, because I think what can happen with us is that we too often see restraint as a necessary part of the suite of tools that we need to use with students, and don't think about, that it's, well, if I have to use it when I get there, that's what I'll do, without necessarily thinking through and understanding what the impact and the implications of restraint can be. So I just wanted to start by reassuring you that at the Council for Disabled Children, we do know a little bit about restraint and have, over the last 14 years, considerably built up our expertise and our understanding in this area. We started, I think, as many people did, with the work around Winterbourne View and the abuse of young adults in that assessment and treatment unit. And that led us into a project that we did with the Challenging Behaviour Foundation, where we looked to understand what good practice was, because I think, we'd all understood therefore what the bad practice was and what we were trying to avoid. But if you're looking to avoid children and young people ending up in secure settings and reaching that crisis point, then what is the support that needs to be in place? What does that look like? So the project that we did with the Challenging Behaviour Foundation was very much looking at that and what were the things that needed to be in place to ensure that students could thrive in settings and receive the support that they needed. We also worked for more years than it should have taken, actually, on the guidance that DHSC and the DFE produce for special schools and secure settings and health settings around reducing the need for restraint. It took a number of years, because when we first started with the Commission on the guidance, it was just going to be DHSC, and we very much pointed out that it was absolutely vital that this was a cross-setting, this was an approach and an understanding that needed to happen in any situation, in any setting where a child might be, where restraint might be required as a result of their neurodiversity. As part of that programme, we had a lot of conversations with young people about who had been restrained, about the impact that had on them and how it made them feel, and how they would like things to be dealt with differently if restraint was necessary. And we had a lot of conversations with staff, and I think one of the things that really struck me as part of the conversations that we had with staff was just how distressing restraint is for them as well. We have been for the last few years the NHS England Learning Disability and Autism Children and Young People's Programme's delivery partner. So we've done a lot of work with them, supporting services and settings that support children and young people who have learning disability and or autism. And lastly, and possibly most traumatically, we supported the National Safeguarding Panel review into the abuse that took place at the 2 residential special schools run by the Hesley Group in Doncaster. And what was really clear there, and I think speaks very much to the importance of what Danielle and Andy were talking about in terms of reflective practice and well-trained staff. What you had was a group of staff who were on minimum wage, who had not been effectively trained, and who were therefore defaulting to responses to behaviour that were restrictive and often abusive, because they didn't have sufficient training in order to understand how to more effectively manage that behaviour in a supportive and positive way. So all of that work obviously means that we are incredibly supportive of any approach that seeks to upskill the workforce and improve their sense of confidence around managing children who may have behaviours that challenge. If you can move on to the next slide for me. So I think it's just really, really important to, and I'm sure you've heard this loads today, but just, and that was what came through to me really strongly when I was talking to children, young people for the development of the guidance around reducing the need for restraint, is how distressing it is to be restrained. And I think, you know, most of us, hopefully, unless you've been on police camera action, have not been restrained. But if you can, you know, the way I think about it, you know, if you're in a row with your partner and they tell you to calm down, you know, it never works. So it's, you know, that's not how we are as humans. So I think just really needing to start with that understanding of behaviour is incredibly important. You have already heard, and I just want to reinforce the fact that if somebody is behaving in a way which makes you feel that they need to be restrained, then what they're really telling you is that they're incredibly unhappy about something, that something is making them feel anxious or panicky or out of control. So it's absolutely imperative that we recognise that and identify what it is that is triggering that behaviour and address that. It's not the inevitable result of complexity. And I think, again, our work on for the National Safeguarding Panel, what that really brought home to me was that what you too often had was diagnostic overshadowing. So you had children who were responding to things that were happening to them as a result of childhood trauma, but it was all being put down to, so I'll give you a specific example. There was a young woman who didn't have contact with her family, who had been put in a group home with another young woman who had very regular family contact. And that was really triggering her because she really missed her family, didn't necessarily understand why they didn't come and see her. So if you just put her response to that down to either her autism or learning disability, then you're doing a tremendous disservice to that young woman, because you're not understanding what it is about her response that comes from the trauma and the experience that she's had. So that's that for that slide. So the next slide really just kind of revisits what I was saying earlier on. Next slide. Oh, sorry. No. Previous slide. Sorry. So that restraint is distressing for staff. You know, having said that, these children are not, you know, they're not when I say they're not complex, I think I agree with Andy. You know, that sometimes their behaviours are very complex to understand, and you won't necessarily always get there. But I suppose I think we do them a disservice sometimes by calling them complex and not then taking, sort of almost excusing ourselves from understanding them, and not doing the work that we need to understand how to positively support them. But then when we're thinking about staff, we have to understand that that is not an easy job that we're asking them to do. You know, it is, you know, I'm kind of thinking about our BSL interpreters and how they get to sort of swap over, which is incredibly important, so that they don't get RSI. But actually, sometimes, you know, we don't think of those things often enough in terms of supporting children who may be difficult to support. You know, how are we supporting the staff in those situations and making sure that they can maintain that focus, that they can maintain that the sort of the hard work, focus on the child, focus on what the child needs, rather than kind of just getting exhausted and taking their eye off the ball. One of the visits that I made when we were doing the restraint guidance was to a secure unit in the Midlands, where it had amazing staff who were doing brilliant things with children and young people. And what I took away from that visit was how distressing it was for staff when they had to restrain a child, and how it felt like a failure. And how, you know, what it meant was that what they had put in place hadn't worked. And I think if we can find ways to support pupils more positively, it reduces a behaviour that everybody finds incredibly stressful and can lead to staff burnout, and increases in sickness, either as a result of, you know, of actually that sort of physical encounter, or as an indirect due to stress. I think sometimes our logical reaction to behaviour can actually exacerbate it, which kind of goes back to the importance of really understanding it. One of the early case studies that we came across in our work was around a young man who was he was a runner, for want of a better word. He was always running away from school. He was always running away from home. And, you know, so he was monitored all of the time, and there were fences everywhere. And when somebody took the time and the trouble to sit down with him and actually kind of understand what it was that was leading to his running behaviour, he wanted some time by himself. So all of the things that were being put in place to manage his behaviour were actually making it worse, because he was being more observed and more monitored. So just so important that we do think about where children, young people are coming from. And I think lastly, probably not lastly because I've another slide, but lastly on this slide, I think sometimes when you talk to people who've implemented these kind of change approaches, they've started out in a place where staff can be slightly resistant to the idea that there should be less restraint. And actually, the evidence is that it works for everyone, that it works better for the children and young people, but that actually, because it does work better for the children and young people, it works better for staff. But I think really important to remember that resistance comes from a place of anxiety. You know, if staff are restraining a child, it is because they think if they don't, then they're not going to be safe, or other children aren't going to be safe. So just really important, I think, to acknowledge where that fear comes from, really. So on to my last slide. So that's why just really pleased and happy to be here today to support the launch of this training. So we think that staff getting that training around de-escalation and promoting well-being in everyday life is incredibly important. So very happy to support the train-the-trainer model. And I think one of the things I've been really pleased sort of to hear people talking about today is that change in sort of culture and the way that we think and talk about some of these children. Another thing that I've taken away from this work they've done that really stuck with me, and it was a member of staff in a secure setting talking just about the difference between a staff shift changeover and somebody saying at staff changeover, Olive was a nightmare last night, and then flipping that over and saying Olive had a nightmare of a night. So just how you think about how you are talking about children, young people, and how you're talking about those behaviours, because actually if Olive was a nightmare last night, it is because she was having a really bad time. So actually kind of flipping that language around can make a real difference. It starts to help us think differently, I think, about the behaviour and about how we respond to the behaviour. Thank you very much.
Thank you so much, Amanda. Everything I've heard today, and particularly now the last final bits from you and Andy, just reminded me what we call at the National Autism Training Programme, the ABCs of love. So traditionally, for many, many, many years now, people have been looking at antecedents, behaviors, and consequences. And we know that much of that concept of traditional behavioral approaches will not work with autistic people who have a different way of understanding the world and potentially are traumatized in sensory, social, and other ways. So the ABCs of love are having to do with acceptance, with belonging and connections. And in order for the ABCs of love to thrive, we talk with the delegates about how we can reframe, exactly as you said, don't call me complex, don't call me disorder, and so on. But I will stop that here, and we will have soon time to hear your questions and to address many of these questions that you have guys posed with Dr. Ruth Moyse. Before we go to Ruth, we have two fantastic colleagues who are at the heart of the National Autism Trainer Programme, Hannah McDonnell and Chris Atkins, and they're going to talk from a National Autism Trainer perspective, information, how to access information, how to register, what to expect during the course of our National Autism Trainer Programme for residential special schools and colleges. That's going to be Hannah. Over to you.
Thanks, Georgia, and thank you so much to everyone else that's spoken today. It's been really inspiring, and it really highlights why this training is needed. And thank you everyone for attending today, and hope you found it really engaging and interesting or excited to book onto the training. So we're really excited for this new pilot for residential special schools and colleges. There's so much for our team to learn from you whilst we initiate this training. Especially the ways that you'll interact with the pilot material and you feedback on it. It will be critical for shaping the rollout of this training stream. Today I'm just going to go through, as Georgia said, some practicalities about booking onto the training, what you can expect when you're in the training and how to qualify as a trainer, and then what support will be available to you after the training. And then Chris will come in afterwards and go through more about that post-training support about the community of practice. If you have any questions, please, as Georgia said and everyone said, please put them into the Q&A and we'll try and get to them in the panel. So we're just going to start off with this animation that gives the kind of brief overview of what the journey that you'll take to become a National Autism Trainer Programme trainer.
What is the National Autism Trainer Programme? The National Autism Trainer Programme, commissioned by NHS England, is a train-the-trainer model delivered by Anna Freud and AT-Autism between 2023 and 2025. Is this training for me? If you are a support worker, team manager, psychiatrist, counsellor, nurse or any other mental health professional across England working in any of these settings, this training is for you. Please make sure you book onto the correct setting. You will attend a 4-day online training course between 9 AM and 5 PM over 4 weeks, co-designed and co-delivered by autistic and non-autistic experts. What will I learn? You will gain an understanding of barriers experienced by autistic people through examples of innovative approaches of working with rather than on or for autistic individuals, including how to reduce restrictive practices. The training covers key approaches including a trauma-informed approach, an experience-sensitive approach, and the SPELL framework. What can I expect if I sign up? Pre-training, you will complete a questionnaire to gauge your knowledge and understanding of autistic mental health. You must actively engage in all 4 training days and complete all reflection questionnaires throughout. You will be invited to join a community of practice to meet with other trainers, share your experiences and develop your training practice. You must attend all 4 training days to qualify as a trainer and gain access to the full multimedia e-library of educational material. I have qualified as a trainer. What now? You are now a trainer. Congratulations. You will be supported to co-deliver the training with autistic experts by experience and embed our approach in your own work setting. You will deliver a 3-day training at least once a year to help other staff reflect on their practice, enhance their understanding of the needs of autistic and neurodivergent patients, and carry out their work more effectively. What ongoing support do I get? Optional additional days of training are available, and you will continue to have access to our community of practice. How do I book? Book your training place now on our website. New training dates are released regularly. For any questions, contact natp@annafreud.org.
So I hope you enjoyed that animation. I think it gives a bit of a taste of the material that we use in the training as well. As we do use those kinds of animations, it's really nice to see a kind of journey for what you'll take as a National Autism Trainer Programme. So in regards to the new pilot for residential special schools and colleges, you can now book onto the 4-day pilot training. We currently have 2 cohorts available, and my colleague, if they haven't already, will put the links in the chat to book onto these trainings. So the first cohort is on the Tuesday, it starts on Tuesday the 14th of November, and it continues every Tuesday for 4 weeks until the 5th of December. So as the animation mentioned, it happens, our training is 4 weeks, 4 days across 4 weeks on the same day of the week. If Tuesdays don't work well for you, we've also got our second cohort on Thursday the 16th of November all the way through to the 7th of December. Just a little bit of housekeeping about booking onto our training. We do at Anna Freud have both paid for and free training. So when you're booking the training, there may be some bits that mention fees and invoices. Please ignore all of this. Your place is fully funded if you meet the eligibility criteria. So it is a free training course for you. When you book onto the training, you'll receive a confirmation email from our system confirming that you've got your place, but then you'll be contacted by our lovely colleagues in our training team that we work really closely with. And they will give you access to your online platform, on our online platform called Blackboard. And this kind of hosts an e-library of resources. It's our one-stop shop for everything that you need to do with training. So we'll have all your training materials, your post-training materials, your Zoom links, etc. You'll also receive your login for our evaluation platform that we use, which is POD, Patient Outcome Data, which I'll go into in a little bit more detail shortly. Finally, just about the booking process, I know a lot of people want to know how many people from your setting should attend the training. We really encourage 3 to 4 people from your setting to join the training. This is really for a kind of peer support point of view. It can be really helpful to disseminate the learning and when you deliver the training in your own setting, as this is the train the trainer model. As it with more of you there to deliver the training, it becomes a bit easier. It also means that when you're doing the training, you're with people that really understand what it's like to work in your setting and in your specific workplace. So when you're attending, hopefully now when you've booked the training, when you're attending training, these are the kinds of things that you can expect. The pre-training questionnaire needs to be completed before your first day of training. So as I mentioned, we use POD to evaluate the training, which is a real-time feedback platform. So before you come onto the training, this really is a prerequisite, as we really need to see where your position is in relation to the content, but also what your expectations for the training are. In addition to this, the pre-training questionnaire, we will also have reflective training questionnaires at the end of every training day, so after day 1, day 2, etc. It's really important and crucial that you fill these out with as much detail as possible, and we'll ask you to reflect on your learning of the day, and it's just really important and forms part of your journey to becoming a National Autism Trainer Programme trainer. The training, as I think was mentioned by Tristan and myself earlier, is completely online via Zoom, and we want to create a really safe space on Zoom, and so our cohorts are relatively small with a maximum of 23 people per cohort. You will be expected to participate fully in the training by having your camera on, join discussions and join the breakout groups. We will have plenty of breaks just to keep up with the pace of the training, but it's so important to know that this is not a passive training opportunity. It's a train the trainer model, so you will be expected to train to deliver the training in your setting upon completion. So it's super important that you engage with the material. As Tristan also mentioned earlier, all our training is delivered by 2 trainers. At least one of your trainers will be autistic, and sometimes both of them will be. This is a really key part of the National Autism Trainer Programme, where everything is co-designed, co-produced and co-delivered by autistic people. And then also, as mentioned by Tristan and Georgia earlier, you will be delivering the training in your setting with an autistic expert by experience. So how to qualify for the training, or how you qualify as a National Autism Trainer Programme trainer. You will need to attend all 4 days of the training and engage with the material, as mentioned, and also complete all the reflective questionnaires and pre-training questionnaires that I mentioned. We really do understand that work commitments are a thing, and they do crop up, and it sometimes means that you may need to miss a day. If this does happen, please let our training team know as soon as possible, as it's in our best interest, and we will do our best to accommodate you so that you can try and complete the training course. This may mean changing onto a different cohort for the day, or just swapping to a different cohort. So it's really important that you let us know as soon as possible, so that we can review your case and make sure that you become a trainer. In order to maintain your qualified trainer status, as mentioned in the animation, you'll need to deliver a 3-day training once per year in your setting with an expert by experience. As I mentioned earlier with Blackboard, all the material that you need to deliver the training in your setting will be available to you on Blackboard and also emailed to you after the training. This includes the actual 3-day training that you'll deliver, facilitator notes, and a training companion, which gives you information, FAQs, and in particular support with how to work with experts by experience. I'm sure many questions will crop up about how to get experts by experience in your setting. So we do have a pool of experts by experience on the National Autism Trainer Programme. And if you would like to work with one of them, you can email us at natp@annafreud.org. I'm sure the email address has been put in the chat, but it may be put in again. So if you would like to co-deliver with them, you can get in touch with us and we can put you in touch with an expert by experience to deliver the training in your setting. Alternatively, if you have an expert by experience in your setting already, or you are an expert by experience and you would like to deliver this training in your setting, please also email us at natp@annafreud.org, and we will set up a training specifically for experts by experience. So you can only deliver the training if you have taken our training. So that's a really important thing to note. Finally, I just want to briefly touch on the support that we offer to qualified trainers. I think it's already really been mentioned by Tristan and Georgia, so I'll just really skim through it quickly. But once you qualify as a trainer, you will hear from us about different things, such as the specialist Train the Trainer days, one-to-ones with the directors and also the community of practice. So our specialist Train the Trainer days will run a couple of times a month, and these will consist of training days with external speakers, and it will be really focused on specific themes like autism and ethnicity, suicide and autism, etc., etc. These are additional training days to your 4-day training, and you'll hear from renowned experts to speak about topics that we're sure that you'll be interested in. We really strongly encourage you to attend these so that you're up to date with the latest research. And then also, as I said, the one-to-ones with directors, that includes Georgia, who's wonderfully chaired today. If you have any practical queries or require more support about on top of what's offered, please get in touch with us at NATP, again, at annafreud.org, to set up one of these one-to-one meetings to help you deliver in your setting, answer any questions about experts by experience and working with them, but also contextualizing the training to your own work stream and your own setting. Finally, and I'll just pass over to Chris now on the community of practice. It is a growing community and it is led by Chris Atkins, and it's available to everyone who's completed the training. And we really encourage everyone to join the community of practice and really fully engage in it, as it's a really supportive part of the programme. I forgot this slide was in here, but thank you very much for listening to me today. If you could sign up to the newsletter, that would be great. And you would just keep up to date with all the things that are happening on the programme, including all of the additional support that we offer on top of the training and when all of our new dates are released. Thank you.
Before, I will not introduce Chris, he will introduce himself. He's our lead of community of practice across all strands of National Autism Trainer Programme. And instead of introduction, I'm just going to tell you that Chris consistently is receiving some of the most excellent feedback across National Autism Trainer Programme in the way that he's holding the space for professionals to learn from each other, to understand from each other different issues, and to feel safe and confident about what they're going to do. We have an ambition. We want to create change. We want our trainers to be agents of change, and that's a really big job, and it can feel very lonely as well until you create a wave of people in your workplace who understand you. So let's hear from Chris Atkins about community of practice at the National Autism Trainer Programme.
Thanks, Georgia. You're too kind, and thanks as well, Hannah, for your introduction. So far today, we've heard a lot about the background to the programme and how you can get involved. We've heard from autistic experts by experience. We've heard the professional perspective as well. But I think, joining and completing the programme is the start of your journey. It's not the end by any means. And I'd just like to focus for the next few minutes on the kind of support that you can expect once you've been through the programme. I'll briefly go over the introduction of what's available. I'll talk about the community of practice in a bit more detail and what that means. Then I'll explain some of the other events that we'll be offering, the shared learning experience seminars and specialist days. I'll try and keep things brief, and I'll summarise briefly, hopefully, as well before finishing. Next slide when you're ready, Hannah, please. So once your training is completed, there's a range of support and resources that are available to the National Autism Trainer Programme trainers. We have various communities of practice which will offer specialised activities and events, and these are intended really to consolidate and enhance the learning and practical skills related to the training delivery. On top of that, we've got separate shared learning experience seminars. They tend to focus on knowledge, understanding, building expertise, and broadening general trainer experience and awareness. Next slide, Hannah. In addition to these events, we've also got what we call specialist days, and these are going to be arranged in response to the trainer's specific requests for specialised support. They'll focus on a much more detailed interactive exploration and examination of topical issues and challenges, things that you think as members of the programme are important and significant. And in addition to all of these events, as Hannah mentioned as well, there's always the opportunity to get specific one-to-one support from the programme leads for individualised queries that may be related to your setting or your circumstances, particular barriers or challenges maybe that you can face. And these will be available on request from the specific programme leads. Next slide when you're ready, Hannah. So just brief background as to what you can expect and some of the kind of theories, at least behind the community of practice. So a community of practice is a group of people who share a common concern, a set of problems, a passion about a particular topic, and who seek to deepen their knowledge and expertise in this area by interacting on an ongoing basis. And for us, in the National Autism Trainer Programme, that means supporting those of you who have completed the Train the Trainer course. The concept of a community of practice really revolves around the idea that learning and knowledge creation are essentially social practices that occur within groups of individuals who share this common interest, this shared domain, this profession. And crucially, these groups of people come together to learn from each other, to share experiences, and collectively develop a shared understanding of their particular field. Next slide, Hannah. For us to be able to do this effectively, we have to be led by the members of the community, those of you who have completed the training. And we'll support members in the areas, the challenges, the topics, the issues that they consider to be important in actually delivering the programme effectively. Effective communities of practice do take time and commitment. And over the coming months, there's a series of events that are planned to start the process of building our community of practice. We hope that those of you that join will all become active members, benefiting from the experience and expertise of the others, but also, crucially, contributing your own skills, your own knowledge, understanding and experience to the rest of the community. This is a shared learning experience for everybody. Next slide, Hannah. So the kind of activities and events that you can expect, just to give you an overview of the kind of stuff that we can do, is we can support and help you in producing leaflets and flyers maybe to make the programme more visible in your setting. We can support you in learning from feedback from users, parents, families, carers. We could help in you trying to consider and reflect on what success is. How do you know when you're delivering the training that you're doing a good job? We'll support you by engaging with current experienced trainers, vital practical tips on what to do, maybe what not to do as well. How can you go about securing the support and ownership of your senior management in your setting? You're not going to be able to deliver this programme effectively unless everybody is absolutely committed to it. So we can help you reflect and learn from the experience of others in actually securing that ownership and support. What works well, what maybe doesn't work quite so well. We've heard consistently throughout today the importance of self-reflection, the impact our own behaviour can have on others. And again, that can be a very important topic that we can help you understand and share your own experiences with. And similarly, once you've been through the programme, you will be co-delivering the training. And that may have some practical considerations that you might want to be aware of and take into account. And again, we'll help and support you with that. There's ways of engaging with trainees as well. You're going to be going back into your own settings once the training's completed, and you're going to need to engage with your colleagues and lock down their interest and commitment to the programme. We can support you in being able to do that successfully. Next slide, Hannah. So, in addition, the community of practice also coordinates and delivers a series of more themed shared learning experience seminars, and these will be available for everybody who's registered with the programme. These will build on the core values you've been hearing about and essential processes and approaches, and will include presentations by leading experts in specialised fields. Recordings, supporting documentation, papers and notes are available after the events for members to use as required in their own training. So these are some of the examples of the shared learning experiences we've been able to offer to date with other streams of work: collaborative work, co-production, co-delivery, service culture and practice. I think it was really interesting to hear Tim at the beginning of the day talk about the end point is culture change. So how do we go about actually achieving that? What about trauma? We've heard again several times a consistent theme is the impact of trauma. What about well-being, dimensions of well-being? And how can a relational or an experience-sensitive approach support us in being able to deliver this program more effectively? What is the impact of camouflaging, masking, stress, anxiety? And how can a family-centered approach help? All of these things are issues that we'll talk about. But in addition to the community of practice events and the shared learning events, there's a series of more specialised specialist days planned. And as I said, these are arranged in response to specific requests from members of the community of practice for particular specialised support. And these will focus on a much more detailed deep dive, if you like, an interactive exploration, examination and reflection of issues that you feel are topical and important for you. Possible topics for future specialist days, for example, may include how to audit your setting using the spell approach. How can you engage with experts by experience? What options are available in terms of employment? What payment models are around? What about autism and cognition? How can we help with that? And we appreciate and understand that all of you will go back to your settings and have very different challenges, barriers, experiences to face. So how can you contextualize and adapt the content of the program so it remains absolutely in line and relevant to the particular setting that you work in? We will support you with that. Models of disability. How can we reflect on the narrative that's often driven, our understanding of individuals, our use of language, terminology? What impact does all of that have on us as professionals and practitioners? So I hope that's given you a quick overview of the kind of support that you can expect, because through the community of practice events, the shared learning experience, seminars and specialist days, we will support and enable you to collaborate, to share your knowledge and to develop your professional practice in delivering this program. We'll provide a safe place for you to build confidence and enhance your professional development, because together we will influence others and we will start to promote positive, meaningful change in the experiences of autistic people in mental health services. The end point is culture change, as Tim said. Thank you for your time. If you have any questions, we're happy to answer them, but back to you for now, Georgia.
Thank you so much, Chris. So last but not least, a really important part of this information session is to answer your questions. And Dr. Ruth Moyse, who is co-director in this big effort, co-director from the AT-Autism side, is here to lead on this discussion. Over to you, Ruth.
Thanks, Georgia. So it's my absolute pleasure to be with you all this afternoon to talk about this really important new strand to the National Autism Trainer Programme. There's been so much information today and so many really important talks that I'm really glad this is being recorded and will be available on the Anna Freud YouTube channel very soon. So you can go back and revisit some of these important talks. And now to answer some of your questions, I will be taking the questions that some of you have submitted during the session today, but I'm also going to be drawing on questions that have been submitted to us in advance of this event today. So if I can start with a question for Tim, please. Two questions, actually, Tim, if you're still with us. First of all, Kate Dixon noted that the programme is fully funded. Can we confirm that this funding is available for all types of provision, that is, residential special schools that are within the independent sector or part of a non-maintained special school?
Yeah, so any school is eligible. When we say fully funded, let me qualify that a little bit. So it's fully funded for people to attend the training, and it's funded for people with lived experience to attend the trainer's training. But what we don't do is we don't provide any backfill for people going back into their organisation and training. We don't provide backfill for whilst they're out of their organisation and training. The school must cover that. And when they're actually delivering in their school themselves, they need to cover the costs of the people with lived experience to deliver their training, and they need to cover the costs of their staff to deliver the training. Does that make sense for the training itself?
That's really helpful clarification, actually, Tim. And just to further question on that, actually, can you confirm the eligibility criteria to attend? So this question says, I understand that it is NHS funded, and my assumption is that you therefore must be employed by the NHS to attend.
The training is for staff working in residential school settings, and the idea is that the training is delivered to the whole team. So whoever attends, we're very happy.
Thanks, Tim. That's great. So the next question is to Georgia, and Chris, I'm going to also ask you to reply as well if you'd like to. What does it actually mean to have a trauma-informed or a neurodiversity-informed approach? How can teaching staff understand and apply? Because it just sounds like buzzwords. So how do we apply that in practice? Georgia first, and then I'm going to come to Chris.
Thanks, Ruth. Did you say trauma-informed and neurodiversity?
Trauma-informed or a neurodiversity-informed approach.
Yeah, thank you so much. So these have become buzzwords, but shouldn't be buzzwords. They are used everywhere nowadays. And it's a little bit sometimes like the autism friendly. People will say, we're autism friendly or we're trauma informed. And when you work with them to pin it down to what type of behaviors you're actually having in order to be autism friendly or trauma informed, people might struggle there to specify what's happening around their attitudes, their behavior, as well as the culture, the work culture, the service culture where they're in. When we talk about trauma-informed approaches, we talk about the fact, recognizing modern science of the last 10 years in the field of autism that is recognizing the multiple layers of different types of trauma that autistic people of all ages may be suffering as a neurominority in a world that the majority of the world is non-autistic. And there are very good reasons to think about trauma-informed practices in relation to behaviors of concern, in relation to lots of to the exacerbation or the creation of mental health issues that autistic people may be facing. In that context, autistic students, diagnosed or undiagnosed autistic students with or without a learning disability. It is really important to consider, and one of the things that the training is doing is demystifying these approaches. Very often, most often, trauma is happening within relationships, the way we relate with ourselves, if we don't accept, if we suffer from ableism, if we have been told that we're not good enough. Relationships with our teachers, with support staff, with members of community who might not understand the way we think, the way we operate in the world, and so on. So the training is very much breaking down what trauma-informed approach means. And what does it mean to work from a relational perspective, not just looking at targeting behaviors, but looking at how we can be together better and make things work. And then when we talk about neuroaffirmative practice, we talk really about the ways to have a very modern, fresh, evidence-based understanding of what autism is and what autism is not. What does it mean to have sensory, cognitive, communication differences? Are these deficits? Are these disorders? Are they differences? Do we understand what reasonable adjustments mean? And when we talk about reasonable adjustments, they are reasonable for who? For the non-autistic person who might hold the power in the organization, or I could give many examples, but I'm aware I talk a lot. So over to Chris to add to that.
Thanks, Georgia. I mean, I'm not sure I've got a lot to offer, to be honest. I think that was, a fairly comprehensive kind of introduction to the notion. But I think I'd like to take a step back if I can, because I think I'd like to think about how important it is in terms of narrative, reputation, terminology, and how we actually perceive other people. Because I think having some tools with which you can hang your understanding of how people work on does give you an opportunity to move away from the kind of deficit-ridden kind of impairment-based language that we use, that actually, often on a subliminal level, does actually dictate how we feel about things. And I think if we can stand back from that and think about the impact on individuals of their experiences, what that means to them, and perhaps more importantly, how that impacts on our own behaviour, then we've got a chance of moving away from this kind of entrenched, let's fix them approach that is really at the basis of the very kind of root cause of a lot of the difficulties we experience. So yeah, that's my penny's worth.
Thank you both. I think it's really interesting you've picked up on that idea of language and narratives there, Chris, when we're talking about trauma-informed approach and neurodiversity affirmative approach. And I'd just like to bring in Amanda and Vanessa actually to see if they want to add anything to this idea of language and the importance of language in establishing the narrative, and how that can actually inform how we then support autistic children and young people. Amanda, do you want to go first? And then Vanessa, I can come to you if that's okay.
Thank you, Ruth. I mean, I don't think I've got an awful lot to add. I think I'd probably just sort of go back to the point that I made in my presentation, really, which is it's not just how we talk about young people, but also how we talk about their behaviour. And I do think it's incredibly important that we do sort of hold on to the complexity of that behaviour, and the fact that that nobody is just one thing. I am, if I am autistic, I am not my autism. Other things have happened to me. So yeah, I'm going to stop there, Ruth, before I run myself into trouble.
Thanks, Amanda. Vanessa.
Okay.
Why is language important for you?
I think language for me is important because I use an example, and I'm not scared to share. I'll share my youngest daughter, Michaela, who I didn't really talk about. The challenges she had getting diagnosed 10 years later was the mishaps of not being believed when she was diagnosed with autism. And then going to college a couple of weeks back to be told by a professional that she was given a lot of attitude. I tried to... I went back and I said, well, you got to change your language, because it wasn't that she was giving you attitude, is that she was actually having a meltdown in a sense of she felt she was not being heard. Went to the college turned and told me now that they were scared of me because the fact that they were scared of how I was talking. And all I said was, because I'm diagnosed autistic, I'm trying to use my lived experience to help my daughter. I found that the professionals didn't want to listen. They felt that I was intimidating them when I know that is not me. So I feel language is really important, and it is about making sure that the families that you're working with, you don't make the assumption, and you check out before you ask. And what I did say, what was really quite sad was that the professionals in the meeting at the time, they weren't white. So we have to educate those that are in the Black and Asian communities as well, because I had to address it and say that I thought I was coming in here to support my daughter's needs, to be told now that I have to check my words because they felt offended what I was saying, and they were not trained in autism. So it is about language and making sure the information that you're getting is from proper resources and not just hearsay, and that's what I can say from my lived experience with my daughter in particular.
Thanks, Vanessa.
Can I just pop in actually, Ruth, and just really support Vanessa's point, because we hear that so often from parents, and that actually especially because of the masking that's been talked about a lot today. Actually, obviously, Vanessa was going into school because her daughter was, apparently, having attitude. But very often we also hear from parents whose children are masking and spending an awful lot of energy masking and in school. So when they then go home, they're having the meltdown at home. So parents are going into school, they're saying, something's not right because this is happening when my child is coming home. And what they're being told is it's their problem. So it is just incredibly, incredibly important that we understand that.
Thank you, Amanda. Thank you for that addition. And I think that ties back, doesn't it, to one of the points Andy made around the difficulty of fear and how that is the transactional, the emotionality of the transactional nature of that. Vanessa, you touched on something that brings up another question, which is that idea of intersectionality and the importance of recognizing the different intersectional layers, for example, through ethnicity. And I just wonder if Georgia and you, Vanessa, and I'm conscious of time and we've got lots of questions, but if you could both maybe give me some ideas about, first of all, Vanessa, why is that so important to address in this training? And Georgia, if you can actually address how we actually address that within the training.
I think looking back when Georgia first asked me to do this, I wasn't sure how to address it, because I think race is a very delicate subject for anybody. And I think being part of this program, I was able to just speak as a lived experience. I wasn't shutting down. I think it is a sensitive subject, but I think we're just able to talk and ask questions and not feel ashamed, because sometimes you may think you're saying something and to be told that you're racist, when we have to have these safe spaces to talk. So for me, anybody who knows me, it's about just say it as it is, and we can correct you without shutting you down. If somebody is there who says, well, you don't understand my lived experience, my take on that is that I'm still learning, because as I said to Georgia many times, I still struggle with the word intersectionality. It's just too many words. I see it as a buzzword, because for me, I'm in spaces where I just say to everybody, my children are Black and they're autistic. But at the end of the day, when I go into a room, they see my son's color of his skin first, they see the color of my skin first, then they see the behavior. So I am always having to explain everything. But when you're in these spaces where everybody is trained, we don't have to be explaining anything. But I think when you're in the local authorities, you're in the team around the child, you're at CAMS, sometimes they're still missing out what's happening in the Black or Asian home. And that was my only challenges I felt in the yesteryears. I didn't know who to speak to, who to talk to, because when I tried to say what was happening, I seemed to get shut down. I don't get shut down now, but I intimidate, I think, professionals now, because when they know my name is Vanessa Bob and they've done the research on me, I don't think they know how to talk to me now and try to do a lot of gaslighting.
Thank you, Vanessa. Georgia.
Yes, thank you, Vanessa. Vanessa is also the CEO of A Second Voice, which means that we're aiming, and we have achieved so far, to have many people from Black Asian communities through Vanessa's network, for all of us, for our internal team, but also for the people we're training, to approach the issue with sensitivity, with respect, and with curiosity. I think that the key two things we're learning as part of the National Autism Trainer Programme is that people from the global majority who are racialized, they will very often be seen, they will have less access to things. We know that there is devastating research that talks about, people dying prematurely, for suffering preventable deaths, because they cannot have health checks. And then the more layers we add to that, we have people who are Black, trans, working class, all these kind of layers. We're trying to represent, to have people from these communities to share material with professionals, because we do know that the more of these layers that someone is sharing, the more difficulties they suffer in the system. And that shouldn't be the norm. We shouldn't even be talking about that. The other part is that.
Sorry, I was going to thank you, but sorry, do carry on.
Yeah, just a final sentence. I think there is something about, understanding also how many we have videos and animations from Black people, Asian people, people from other ethnicities, that they're telling us that they suffer a double marginalization. So not only the white professional doesn't get them, but also within their communities, autism might still be a taboo and so on. So we're trying to cover both of these aspects in our training. Thank you.
Thanks very much, Georgia and Vanessa. Irina, I have a couple of questions for you, please, now. How does it work if you are a professional working in a setting wanting to take this training for your own role, but you're also an expert by experience? Can I still take the upcoming pilot training?
I wonder if Georgia can also chip in, but we have had situations where people are they have a double role in their setting. They have clinical background, but they're also working as experts by experience. Obviously, they will not be able to co-deliver as one person, so they will have to choose one of the roles when they're co-delivering. But in terms of our recommendation, we recommend that they train both as an expert by experience and as a trainer if they are able to deliver both roles and have both roles. I think I wonder if the question refers to the pilot that we're running in on the 14th of November. So the recommendation would be for them to join the pilot and train. What we've also identified, somebody else on the CAMS community training who works as an expert by experience on the training, but has also the ability to work clinically. They have completed the 4-day training and they're a trainer, but then they've recommended somebody else from the service who is an expert by experience to join the expert by experience training and co-deliver the training with them. I hope I haven't confused people more around this.
That's brilliant. Thank you. And one other question for you, Irina. How do I deliver the training? Do I have to deliver 4 whole days as a block, or can I split it up in some way?
So as Hannah mentioned, once you qualify as a trainer, once you go through the 4 days of training, engage with the training, complete all the reflective exercises, and certify as a National Autism Trainer, you will be expected to deliver a 3-day training in your setting. You will have access to the materials, the facilitator notes, and then you'll be expected to co-deliver this 3-day training at least once a year to keep your trainer status. You will be paired with an expert by experience, either from the National Autism Trainer Programme or one that already works within your service, and you will co-deliver the training. Through the community of practice and additional support that Hannah mentioned around the one-to-one with that you can request with one of the directors, you can then work on contextualizing the training in those 3 days. And going back to the point that Tim was making around the fact that there is no actual backfill for the trainers once they go back into their setting to deliver the training. And we also understand the time pressures that sometimes it's virtually impossible to deliver to a whole team to find time for 3 days to deliver a 3-day training. So there's a lot of support on how to deliver these 3 days in 6 days or 8 days, depending on it's on a case-by-case basis, and I wonder if Georgia wants to add anything to this more specifically. But through one-to-ones and through community of practice, each individual certified trainer will be able to then contextualize how they deliver those 3 days in their own setting, depending on how many team members they want to deliver to, or sometimes they want to deliver across several settings within their service, across several teams, and so on.
Thanks very much, Irina. Georgia, I'm very conscious of time. I have lots of other questions, but over to you. You want me to carry on? Okay, so I have a really good question here. I'm going to start, I'm going to let you choose. What is different about this training that I can't just get from reading the latest books and reports on autism and mental health. Why should I attend?
Are you asking me?
Go ahead, Georgia, yes. And then anybody else can chip in if they wish.
Please do. I love this question. Okay, so I think that the training is offering a unique opportunity for people, for one, to cover to close the gap in their own knowledge base, to get a very fine understanding of what does it mean to be autistic, not from secondary resources, reading from a book, but reading stuff from people who are world leaders in the field of autism, but also all these are presented in an authentic way by autistic people. So I think the feedback we get is that it's a very unique opportunity to spend 4 days in the training. At least one of your trainers is going to be autistic. In many cases, it's going to be 2 autistic people delivering to you. And the depth and the breadth of their experiences is just fascinating. It puts everything to life. That's one element. The second element is that our trainers are going to model for you what is it like to create change through collaboration. What is it like to co-deliver? What is it like to co-intend, to think together, for autistic and non-autistic people to be together, to plan together, to debrief together, to learn from each other as well, and to learn how to share perspective. And the third part is that you will get a sense of pride and love. I think that you're going to love much more your work, and you will be able to offer back to your colleagues. You will be able to you will have time to digest the new knowledge that you might get through the training, and you will have lots of channels like the community of practice and the specialist days to keep on being engaged. Many of us have been in tons of trainings in our career. We go to the training, we love it, we say fantastic, or we didn't like it, whatever, and then it stops. We have until spring 2025 to work together, to keep on learning together. And if you attend this training, you become a part of a very big national community.
Thanks, Georgia. I'm very Chris, go ahead. I'm conscious we need to make this the last question.
Really briefly, I'd just like everybody to think about, I don't know how long ago that kind of abuse scandal at Ely Hospital in Cardiff was, but that was the first one that I can remember, and it was many decades ago now. And we get the same stuff happening. Year on year, the same stuff happens. Whatever other options we've had don't work. Nothing works. We've got an opportunity here to take a bit more of a radical approach, looking at individuals from a very respectful and understanding point of view. So the difference I would suggest is that we've got a chance of actually making an impact on people's lives here. You know, we have to do this for the best of reasons. That's all I wanted to say, but thank you.
Thanks, Chris. And Vanessa's just added bringing collective autistic voices together. Absolutely, yeah. Thank you very much. Conscious that our interpreters are also booked to go elsewhere and wanting to give them a break. So I'm going to hand back to you now, Georgia. We can answer these questions in a separate document and circulate to everybody, can't we? Yeah.
Thank you so much, Ruth. You had a difficult task to wrap up everything beautifully together. Thanks for that. Really, a big heartfelt thank you on behalf of the whole of the team. You see few of us today, but we're more than 60, no, much more than 60 people actually, behind the scenes, working to set up the program, to make it work, but also to keep on supporting you ongoing until spring 2025. We want this to be a good experience for you all. We want this to be translated into outcomes, into improving the outcomes for autistic and non-diagnosed autistic people that you're working in your settings. And yes, really a big thank you on behalf of all of us. See you in one of the trainings. Take good care, and we will send all the material along with all the unanswered questions. We will also answer these questions and send them to you along with the slides. Thanks for everything. Bye.